being here. We're going to get started this afternoon. I'm Senator Craig Brandt, and I get the privilege of chairing today. I thought it was really interesting, the article yesterday in the Journal, which timing-wise was really right on time, right? I don't know if you all saw it, but it was talking about New Mexico's health crisis is forcing military personnel to decline assignments. And what it's talking about is we have twice the rate of military personnel when they get orders here, having to decline those orders because we do not have the doctors to take care of their families' medical needs. Now, I'm going to tell you, if that continues, you can say bye-bye to our bases. So think about that for a minute. They can't continue to do that. And I've known several people that have actually been here and had children, and because of medical reasons, they had to ask for emergency orders out of here. And so that's, again, is just one of the things that we're dealing with as we deal with this medical crisis in New Mexico. Myself personally, I've been having a lot of medical issues. It's pretty hard to find a doctor, even for a senator. So it's hit home personally for me. In fact, the VA wanted to send me to Arizona to have a back surgery because they were concerned they couldn't find a doctor here. I was able to find one that's actually very good, but that's the problem that we're having here in New Mexico, is we don't have, especially specialists, right? That's one of our biggest areas of concern, is if you have any kind of specialty need, it is very difficult to get in. And so we're going to look at why that is. We're going to talk about why that is, but I want to give an opportunity for our panelists, our senators, to introduce themselves. I'm going to start with Ant, and we're just going to work our way across. So, Anthony?
Thank you, Mr. Chair. My name is Anthony Thornton. I'm the senator for District 19, which is the East Mountains of Albuquerque. It includes Bernalillo, Sandoval, Santa Fe, and Torrance County. So, like me, you've probably seen the shocking statistics that says New Mexico is the only state to be losing doctors. But the data behind this headline is even more troubling. According to research reported by the nonpartisan Cicero Institute last spring, 32 of New Mexico's 33 counties are health professional shortage areas. By 2030, only 5 short years from now, New Mexico is projected to be 2,118 doctors short of what we need. And worst of all, roughly half of the medical residents completing their education here in New Mexico would choose to practice in another state. So what does that mean for patients in New Mexico, including us, our children, and our aging parents and grandparents? The Cicero Institute goes on to report that New Mexico's physician-to-patient ratio is far below the national average and getting worse, especially when it comes to specialty care like gastroenterology, urology, and internal medicine. Now, just this weekend, I received a letter from a Dr. Casey Carroll. Dr. Carroll was raised in Roswell, New Mexico, graduated from Roswell High School, completed medical school at the University of New Mexico, and trained in internal medicine at the University of Colorado. So after practicing in Colorado for 2 years, she returned home to New Mexico, where she has provided primary care for the past 5 years. She said that she is frequently asked by current patients whether she is accepting new patients, as their family members and friends are unable to find a primary care physician or are on a years-long wait list for a primary care physician. Others express concern about continuity, as she is often their 3rd or 4th provider in recent years. Access to specialty care is similarly strained. Routine screenings, such as colonoscopies, are being scheduled 7 months out, and wait times for specialists like endocrinologists or dermatologists often exceed 9 months. She stated that these issues were not present during her time practicing in Colorado, our neighbor just to the north. So Dr. Carroll stated that another significant challenge is the state's medical malpractice environment. New Mexico is widely regarded among physicians as a high-risk malpractice jurisdiction, which deters recruitment and retention. She stated that she has seen many colleagues leave for more favorable practice climates and is frequently asked by out-of-state peers about the malpractice risks here based on what they read online. So while improving healthcare access in New Mexico requires a comprehensive strategy, malpractice reform is essential. Measures such as capping attorney's fees, restructuring payouts, raising the threshold for punitive damages, and joining national healthcare compacts would meaningfully improve physician recruitment and retention. New Mexico is bleeding doctors, and we have to stop the bleeding. If we don't, New Mexico won't survive. Our economy won't survive. Our communities won't survive. And even our loved ones won't survive. This isn't melodrama. It's the truth staring us in the face. And our constituents are demanding that the legislature address the crisis we're facing. I'm hoping that today we gain a better understanding of what's causing it and how we can solve it. We can't afford any more delays. Thank you, Mr. Chair.
Thank you, Senator Thornton. Appreciate it. Pat, and remember we have 4 minutes. You were perfect, by the way.
Thank you, Mr. Chairman. Thank you for convening this task force. I want to talk a minute about the little town of Clayton, New Mexico. We have a hospital there in Clayton. That's the northern end of my district. It is a very small town. Hospital's not very big, but guess what? They had to try to find a new provider for their liability insurance. They could not come up with anything until they had a 500% increase in their provider's insurance. Now, that's pretty hard to get enough customers in the door to pay a $850,000 premium. Many of our constituents go to Texas or Oklahoma or Colorado. My district touches all three of them. But now they have to sign a waiver so that they will not be sued in a New Mexico court. Those doctors won't be sued. We've got a problem here. We've got a problem of no providers, doctors leaving. We've got a medical school educating doctors, but those doctors not staying in state. We've got to figure this deal out, Mr. Chair. And I'm looking forward to this task force to put all these issues together to see what we can come up with. Thank you, sir.
Oh, thank you, Senator Woods. Appreciate that. I'm going to go to Senator Block.
Thank you, Mr. Chair. First of all, I'd like to thank Sandoval County for hosting us. This is my old stomping grounds for 8 years as a county commissioner, sitting right in this chair at this spot. So it's good to be back home. I also want to thank, Mr. Chair, Senator Gallegos for being here as well. I appreciate you, sir, being here and your work on the Senate Public Health Committee with me on that. You know, Mr. Chair, I have 2 hospitals in my district. I have Rust and I have Westside Loveless. I might be the only state senator up here with 2 hospitals in the district, and I'm on the Public Health Committee. So this is near and dear to my heart. We all have health issues, whether it's our spouse going through it with our spouse or we're going through it personally. I battle skin cancer. I had to wait for a colonoscopy. All of us have had to deal with the healthcare system here in New Mexico, which ain't great. When you look at the other states, Mr. Chair, that are doing phenomenal when it comes to healthcare with access, Massachusetts, Minnesota, New Hampshire, why are they doing good? Well, because of medical malpractice. They're actually attracting doctors like Texas. And when the chair talked about many doctors that are retiring and the new doctors can't take any more patients, that's a problem, especially in rural New Mexico that I represented here in Sandoval County. Senator Woods represents over in the eastern part. The chair also said something that hit near and dear to my heart, because he's an Air Force vet and I'm a retired Air Force officer. Think about Clovis, Cannon Air Force Base, and Holloman. They're in rural areas. They have very critical missions that they have to do. And by the way, when you have 25 to 33%, you're turning away airmen and their families under something called the EFMP program, that affects military readiness for the country. Kirtland Air Force Base is one of those bases that's in a metropolitan area, but it has the highest rate of turning airmen and their families down than any Air Force base in the United States in the metropolitan area. If you're not familiar with Kirtland Air Force Base and all the mission partners it does, it is vital to national security with specific skill sets that these airmen do every single day. You can't just produce a nuclear weapons technician. Very small amount of people do that. And when those people can't get here because of the health care, it affects our national security. And by the way, these airmen, these young enlisted people, they're sending them from Holloman Air Force Base. They're going all the way down to El Paso. That's a big affordability issue for some of these young families as well. I said it before, and I'll say it publicly. The trial lawyers in the state of New Mexico is the most powerful lobby that we have here in the state, and they're scumbags. Why do I say that? You can write that down. I say that because they're pocketing money over your access. If you can't afford to go see a urologist, can't afford to get a mammogram, can't afford to get a cancer treatment, can't afford to see a neurologist, blame a trial lawyer. They're the ones that are sending a lot of money to state reps and state senators. SB 176, Senator Pat Woods, Senator David Gallegos, those two gentlemen fought extremely hard with the other side to get that bill through. And it was shot down in my committee because the trial lawyers showed up and lied. They are complete scumbags. And I'm sure I just lost a lot of money when it comes to political contributions. But you're losing a lot more than money. You're losing your lives. So please remember that. You talk to all those representatives and senators taking money from the trial lawyers. You go up there to the roundhouse and you tell the truth, because I know you will, and you make sure your stories are told. Enough is enough. New Mexico is bleeding doctors and people are dying, and it's their fault. So I look forward to this today. Thank you, Mr. Chair.
Thank you, Senator Block. Appreciate you calling a spade a spade. Senator Tobiasen.
Thank you, Mr. Chair. In 2017, my husband faced a massive health crisis. He had to be transferred via medical jet to Cleveland Clinic to save his life because we didn't have the specialists here who could help him. And now my husband has contracted West Nile virus. And for the last 3 weeks, he's been fighting for his life in ICU, completely paralyzed, helpless, laying there. And the tests that they sent out of his blood work and the spinal tap, those tests couldn't even been run in New Mexico. They were shipped out to Utah, to Washington, to California, to Arizona. And those tests were delayed time and time again. And if we hadn't been here in Albuquerque 3 weeks ago when my husband took a turn for the worse, he would be dead because he wouldn't have been able to get to the hospital in time. When your loved one is laying in a hospital bed, time matters. Care matters. Expertise matters. The litigious culture towards doctors in our state is so toxic that recruitment and retention is next to impossible. I have lost track of the traveling nurses I have spoken to, of the medical professionals that are overworked coming in on their days off. One of them came in after 4 hours of sleep the other day to give my husband dialysis because he needed it so badly, and there was no one else on staff to do it. I've lost track of the doctors who have come up to me and pleaded for help, that they can't continue this way. And they're worried, they're scared, they're watching their colleagues leave every day. I'd like to say to Senator Cervantes, the trial attorney that is the chair of Senate Judiciary, you have a quote. You said that the interstate medical compacts are a threat to New Mexico's sovereignty. Senator, no one is buying that rhetoric any longer. Your words are shallow, they lack compassion, they lack reason, and they lack action. To the Trial Attorney Association of New Mexico, please come to the table. I speak for every New Mexican who cannot find a doctor, who has delayed necessary care over and over again for months, for a year plus, for people in rural counties that are having to drive for hours to find a hospital who can even help them, for women who are driving for hours and planning their pregnancies because their rural hospital can no longer birth their babies. I speak for every single New Mexican, just like my family, my husband, who had to leave the state initially to get care. I speak for every one of you when I say to every legislator in the House and the Senate, it is time that you step forward and you either lead, follow, or get out of our way. Thank you, Mr. Chair.
Thank you, Senator Tobias, and I ask all of you to keep her husband in your prayers. I'm going to be pretty blunt, too. Why are we doing this here? Why aren't we doing this in an interim committee? I think that's a question that needs to be asked. I hope you all are asking that question. I hear you asking it to me. All right? Well, let me address that. We have at least two, maybe 3 or 4 interim committees that we asked that this be put on the agenda. The Democrat chairs of those committees said, no way. They refused to even talk about the medical situation in our state. They refused to even look at why doctors are leaving our state. And when they do, they look at little things. Well, maybe if we could just change this, tune this up a little bit. The fact of the matter is, when I talk to doctors, when I talk to the doctors' associations, the medical society, the number one thing that is keeping doctors out of the state of New Mexico is the cost of medical malpractice insurance. So how did this happen? How did we go from not having that big of an issue with this to now having this huge crisis in our state? Well, in 2021, we had a bill that came forward that was brought by the trial attorneys, by the Trials Attorneys Association, and we were all lobbied very hard. And a couple of us missed the unintended consequences of that bill, which actually weren't unintended at all. I'll sit here right now and tell you I voted for that bill because I didn't catch it. I didn't see what it was going to do. There's a one-word change in a portion of that bill that basically makes it where one incident you can file about, it's kind of unlimited how many lawsuits on one incident because they changed the definition of occurrence. Just a simple little thing that we missed. So where do we go from here? Well, we've got to go back and fix that. We've got to go back and fix that language in that bill, and we need to look at what other states are doing. Why is New Mexico the second highest cost of medical malpractice insurance in the country? Good Lord, we're one of the poorest states in the country, and we've got the second highest rates of malpractice insurance. We have lawyers coming from all over the country to New Mexico. Now, they don't have to worry about health care because if they get in a health care crisis, they just fly to another state. They're wealthy enough to do it. But over half of our population's on Medicaid. They can't go to another state. Medicaid only pays for their care in New Mexico. Doesn't even matter if they're on the border. They're stuck here. And yet the doctors can't treat them because they can't afford what they get paid on, reimbursed from Medicaid, because their medical malpractice is shot through the roof. Heck, this is the first time that I can say I would be better off in California than in New Mexico. I grew up in California. I hate that state. But I'd be better off when it comes to health care in California than New Mexico. Why? Because California actually caps what you can get. California actually caps what the lawyers can get. We need to do those things here. We have got to restore some common sense to our medical system in New Mexico. And so I call on Representative Chandler in the House, who chairs the Judiciary Committee in the House. Here are the dadgum bills. Let them be heard. Let's get this situation solved. Quit denying that it exists just because you're a trial attorney. I don't know why the Ethics Commission hasn't looked at some of that. But it's time we change things in New Mexico. It's time we make it where our doctors can stay here so that when we get sick, or our family gets sick, or our loved ones get sick, that they can be treated here and not have to be flown to another state to survive. And so that's what we're going to look at today. I thank you for letting us open, and I would like to ask Secretary de Blasi to join us. And I do want to just say, Secretary, we really appreciate that the governor has been willing to work on these issues and been willing to work with us. We worked with her a few years ago, Senator Baca and I, and some others, Senator Moores at the time. We worked on getting a stopgap, but it's not enough. And so thank you for being here, and we are glad to hear from you.
Thank you, Mr. Chair. Senators, I want to thank you first for the invitation to be here on this important subject matter. I can tell you that the governor is very committed in medical malpractice reform. She recognizes the challenges that we're having in the state, such that she convened a medical malpractice summit on September 12th at her residence. And we invited an important group of individuals that is representative of the stakeholders. We had legislative leadership, we had trial attorneys, plaintiffs' attorneys, medical groups, hospitals, a couple of cabinet secretaries, and the chambers were represented. And we took an approach such that we engaged with an international actuary, Willis Towers Watson, to really look at New Mexico, how it compares to our neighboring states, as well as the rest of the nation. And then we also invited the National Medical Malpractice Liability Association, who looked at New Mexico compared nationally in neighboring states as it relates to medical malpractice premium and the associated costs. We wanted to have a balanced approach, so we also invited a victim of medical malpractice to tell us their story. It was former Representative Debbie Armstrong spoke about her daughter and what happened with her when she was young. And then we also heard from Dr. Brooke Baker from the University of New Mexico that really spoke about the patient-physician relationship and how important that is. And when you've got really strong connections and you have a relationship and you're able to spend time and you're able to apologize when something goes wrong, that goes a very long way. So there are some apology laws that you're starting to see across the country coming up through medical malpractice reform. So what did we learn? Well, it's in essence what you all were just talking about, but I'll give you some specifics from the presentation. The actuary utilized the National Practitioner Data Bank, which is public information. And we also had claims run out of our patient compensation fund from the Office of Superintendent of Insurance here in New Mexico. And the data tells us that New Mexico has 50% more medical professional liability per capita than any of its neighbors. Premiums exceed all neighboring states. Internists are 33% higher than Texas. General surgeons, 50% higher than in Colorado. And OBGYNs, 50% higher than in Utah. New Mexico premiums exceed all but one patient compensation fund state in 2024. And that would be the state of Pennsylvania, who's struggling with their own medical malpractice challenges. Pennsylvania internists and OBGYNs, internists run about 6% higher, and internists 3%. New Mexico's premiums rose 63% in the last 4 years. New Mexico has more physician claims than the U.S. average, and the gap has widened in recent years. And New Mexico has far more claims than our neighboring states of Arizona, Colorado, Texas, and Utah. We have an average of 60% more claims per physician than the rest of the country from 2012 to 2019. However, the gap has widened to 140% more than from 2020 to 2024. Our neighboring states, the gaps are larger, 2 times as many claims per physician from 2012 to 2019, 3 times more claims per physician in the most recent years. So as I stated, this was really important information. We wanted to make sure that we had a well-respected actuary provide the data. There's always individuals poking holes in data. The actuary is willing to answer questions if any are brought up, as well as the Medical Professional Liability Association. And as I stated earlier, the governor really wants to work on this. We will be forming working groups shortly after the special session, make sure that we've got good representation to tackle this challenge.
Thank you, Madam Secretary. Appreciate your willingness to join us today and talk about this very important issue. Anyone have questions? Pat?
Thank you, Mr. Chairman. Madam Secretary, thank you for inviting me to that very summit you're talking about. I came away from that with the feeling that everybody in the audience, and I'm sure everybody in this room, has the same feeling. How do we provide the best medical coverage we can provide and have the best outcome for the patients? You're going to have a certain amount of time that a patient, something happens in that care. And I know that we talked some, I believe it was a model from another state. Do you remember what state that was where they actually had some mediation? And tell me a little about that, if you would, please.
Certainly. Mr. Chair and Senator Woods, it's the Candor model, CANDOR. And what this does is it allows an opportunity for the provider with the patient to openly discuss some of the, if it's a mistake, or if there's a concern, something didn't go quite right, versus the provider being fearful of having that conversation and just stopping all communications with the patient. That's why that relationship is so important. And as I stated, there are other states that have recently enacted what they're calling apology laws, and it allows for an open conversation between the provider and the patient.
And from what I understand, Mr. Chairman, when you go to a doctor, a patient-doctor relationship is so important. You have to have trust between the two of them. In our state today, if there is a claim filed, immediately all conversation is stopped.
Mr. Chair, Senator Woods, that's correct.
And you know, we often think about the patient, but think about the doctor. The doctor does not feel well about the outcome of this situation. And, you know, we talk a lot about behavioral health in the whole population. When you're not allowed to even discuss what happened with the patient, and you're not allowed because whatever you say can be used directly against you in a court of law. So it creates such a negative deal to happen within our society. Another thing that happened in that particular summit was we heard a lot about how we're going to, or how other states are modifying laws to make it such that the patient gets better care. And we have a patient's compensation fund in our state. Now, in that fund, right now, the hospitals will be pulling out this next year or this year. Do you happen to remember how much money they put into that fund annually?
Mr. Chair, Senator Woods, I do not.
I think they're asking for about $200 million from the state to make that fund whole from when the hospitals leave. Very briefly explain what that fund is supposed to be for. I mean, it's a patient's compensation fund that is supposed to make the patient whole in their medical requirements, future medical requirements. I think I'm in a short run around. Maybe you can explain it a little bit better than that. But
Mr. Chair, Senator Woods, I'll do my best. The Patient Compensation Fund right now has a cap for the independent providers, I believe, of $750,000. The hospitals are moving up to $6 million in their cap. And we did the fix a couple of years ago for the ambulatory surgical centers that were lumped in originally with the hospitals, but with that fix, they've been capped at $1 million within the Patient Compensation Fund. The Patient Compensation Fund does not cover any punitive damages.
it doesn't cover the punitive damages. But from what I understand, in a lawsuit, and I know me or you, neither one are attorneys, so let's don't play like we're even on TV. But when you do something on contingency, you don't charge your client anything, but you, in the settlement, you expect to get paid during the settlement. So if there's a future fund set up or a settlement made to take care of that patient in the future, that's the actual damages. And then the contingency comes off of that. That patient is actually the one that loses that much money for future medical care. And supposedly this fund that we set up, patient compensation fund, was supposed to help with that. Is that also true?
Mr. Chair, Senator Woods, I'm not sure about that. I think that, the attorney's fees for any claims, those are negotiated between the patient and the attorney.
And I understand that. But whenever you take that money off the patient's settlement for future medical help, then the patient is actually short that amount of money for the future.
Mr. Chair, Senator Woods, that's correct.
I'm getting a whole lot more complicated than I know about. I'm going to quit while I'm behind. But thank you for your answers, Madam Secretary.
Senator Block?
Thank you, Mr. Chair. Madam Secretary, you and I met during the session a few times, and I can honestly tell everyone who's watching that you are really for the people, and I appreciate that a lot. Senator Tobias and I, we were with the governor on Friday, and the governor talked to us about how important this medical malpractice is, and she was not happy with her side of the aisle not getting this done. The governor wants to get this done before she's out of office. It's that important to her, and I know it's extremely important to you, and I want to thank you and your department for all you do for New Mexico. Senator Woods brought up really a great point in this, because doctors are very risk averse in New Mexico when it comes to treatment, because they're not willing, and I've talked to doctors about this, and they're not willing to kind of push the envelope with some people that need treatment, because they're so worried about this coming back on them with these lawyers trying to line their pockets. Doctors have a very, very tough job, and I trust these doctors that they're trying to make the right decision with the tools and that they have, which brings up another point regarding medical technology in New Mexico. What type of medical technology are you seeing invested in New Mexico versus other states? I would argue that the technology or the investment is not there because it might increase risk a little bit in some treatments. And Senator Thornton and I just recently on a trip saw some incredible technology on the medical side that Israel is doing for cancer research and other, and I'm sure Senator Thornton will talk about it. That's kind of in his wheelhouse, the technology stuff. But we're really losing out on medical investment with technology and new procedures here in New Mexico. What are your thoughts on that?
Mr. Chair, Senator Block, I wouldn't be able to answer specifically to the technology that we have in the state compared to either the rest of the country or the rest of the world. What I can say is what I believe you're speaking to is providers, because they're fearful, they're practicing defensive medicine. And at times that can lead to, as you stated, always not potentially discussing or offering some of the latest treatments that might have higher risk.
Thank you, Madam Secretary. Mr. Chairman, I was talking to Dr. Richards over at UNM, and one of the good news about New Mexico is this is one of the best places to come for medical doctor's residency. The problem is when they're done, do you know where they go, Madam Secretary?
Mr. Chair, Senator Block, I'm sure you'll tell me.
I certainly will. They leave the state. They leave the state. We have, in my opinion, one of the top residency programs in the United States here at UNM. People want to come here. It's very competitive. But then they realize the environment when it comes to litigation, and they leave. And they leave us high and dry. And you were talking in your opening statement regarding some claims. And I understand the percentages of, the higher percentages of our neighbors. I get that, but you said something that kind of, I haven't heard before, and it relates to the number of claims in New Mexico that are more than Texas and Arizona. Are you talking per capita or are you talking overall claims?
Per capita, per physician.
Per capita, and can you tell me what those numbers are for, say, Texas and, do you have those of our neighbors available per capita?
I don't have the exact, Mr. Chair, Senator Block, I don't have the exact numbers, but I'm happy to follow up and get that information to you.
I think that would be helpful to have that information. And, one of the other things, and I was talking to a fantastic doctor, a guy named Dr. Jay Bishop. Jay Bishop is at SRMC. Men's health is a big issue in this country. Dr. Bishop is a urologist. And he told me an incredible stat that I want to make sure that everyone hears this and understands where we are when it comes to men's health. My dad just went through radiation treatment for prostate cancer. And prostate cancer is going to hit 1 in 8 men in the country. In the Albuquerque metro area, we have about 15 urologists for well over 1 million people. Durango, Colorado, Madam Secretary, do you know how many urologists are in Durango, Colorado? I'll give you the
Mr.
answer.
Chair,
If you
Senator
say
Block.
8, you're going to be right. How many are there?
Mr. Chair, Senator Block, I believe there are 8.
Exactly, there are 8. And that is a town of, do you know how many people are in Durango, Colorado? Just say 38,000.
Mr. Chair, Senator Block, 38,000.
You are just on fire today. We're talking months before people can get treatment for prostate cancer. We just had, I love these medical compacts because I think it's a stopgap. I don't think it's the end-all to end-all solution. It's a stopgap for what's going on. But we had a couple other bills in there and that I supported on the optometry side for ophthalmologists and optometrists to do a little bit more to treat people with eye care. And in New Mexico, and unfortunately I think the governor vetoed that bill. I'll have to talk to her about that because I have another, I'm going to see her again soon. And by the way, she was very nice to Nicole and I. She's a nice lady. I like her. Eye care is another huge issue in New Mexico because, Madam Secretary, is New Mexico the population getting younger or older?
Mr. Chair, Senator Block, we're getting older.
We're getting older. I'm in my 20s, okay? So I got a little ways to go. But the stress on the healthcare system for those 65 and older is a lot more than people that are in their 20s and 30s and I would argue even their 40s. It's getting to be more and more of a crisis. I talked to a family, and I think they're going to speak today. They bought their dream home down here from Fargo, North Dakota. They bought their dream home down here 5 years ago. And one of the couple there, they had some medical issues and they were able to afford to go to Phoenix. But like I think the chair said, we have over half the people here in New Mexico on Medicaid that can't afford that. So it also causes a huge burden on the families, for those family members to take care of those members that are having these health issues and they can't afford to get treated. So this is like a slippery slope that we're going on here in New Mexico, and it just seems like it's really inhumane. What's going on here in New Mexico is inhumane. We get one side of the aisle, they like to lump us in different identity politics of white, Hispanic, Black, Native American, people of color, whatever. This is affecting everybody. And yet, I don't understand why some on the other side of the aisle, every Republican is going to support SB 176. Every Republican will or did. But for people to sit there and talk about how much they care about the rural areas, or they care about those that are low income, it's complete bullshit. Because what they care about more is just getting reelected and getting that money for reelection at the cost of people dying in New Mexico. And I think I'm out of time, but I want to thank you for all you've done and talking to me and being very patient with me during the past session. I very, very much enjoyed that. And I hope you stick around for, another year and a half or so, or maybe the next governor will reappoint you, because I do think you're doing a good job. And I want to thank you and your department for that. Thank you, Mr. Chair.
Thank you, Senator Block. And, this was the one thing I was afraid of, is that we all like to talk. And so we're trying to keep it in schedule. Senator Thornton, you had a real quick question. We need to just keep it quick because we're already 6 minutes over.
Yes, Mr. Chair. I think Senator Block asked one of my questions, so I'll just be real brief. Madam Secretary, you had mentioned that the premiums have risen 60% over the last 4 years. Would you tie that directly to the Medical Malpractice Reform Act that was written in 2021?
Mr. Chair, Senator Thornton, when you look at the data, there appears to be a correlation.
That's what I thought. You also said that there are 140% more claims per physician now than our surrounding states. And so I'm asking, do you think our doctors are that much worse? Are our doctors poorer than the surrounding state doctors? Or is this are there attorneys here looking for opportunities to take advantage of the situation? And I know I don't want to put you in that. Let me just ask the question. Do you think our doctors are so bad that they would require 140% more claims against them?
Mr. Chair, Senator Thornton, no, I do not. We've got excellent providers in this state that are doing the best job they can to serve New Mexicans.
I would agree with that. And I was going to tell a story about my wife, and maybe I'll include it in another section here, but I'll just reserve that for a later time. But thank you, Mr. Chair. I just wanted to get those 2 points across. Our doctors are not any worse than the doctors in the surrounding states, and yet there are being claims against them at a rate much, much higher than our surrounding states. Also, we see that the premiums have increased as a result of the medical malpractice reform. I'm just trying to make a correlation here between that reform and the impact that we're seeing right now in our state. And I think that's where people need to understand the difference of what's happening in this state. It is the exact result of that Medical Malpractice Reform Act that we're seeing the results that we're seeing today. We have enough evidence. We don't need any more task force. We don't need any more evidence to support this. We need to change that law. And that's what I'm hoping we can do, hopefully, in the next session that comes up. Maybe even in this special session that happens this week. Thank you.
Thank you, Madam Secretary. Really appreciate you being here. And we're over time, so I'm not going to ask any questions. Do you have anything that you want to wrap up with?
Mr. Chair, thank you again for the invitation. I do have one thing to say, Senator Thornton, about the last comment that was made. The one thing that we are challenged with in New Mexico is we have such a shortage of providers, which that in itself could be driving some of the medical malpractice as well. So it's a multi-factor issue that we're facing in New Mexico. There's been a lot of investments to try and shore up providers in the state with rate increases, Rural Healthcare Delivery Fund, the Healthcare Delivery and Access Act. But those in themselves are not going to fix our provider shortage in New Mexico.
Thank you. I agree. All right. Next, we have for our next panel, Jeff Crosdell and Terry Cole. Jeff is a legal expert with Rodney Law Firm. He is involved in the medical malpractice defense for more than 25 years, generally representing Presbyterian healthcare services throughout the state. Jeff, thank you for joining us. Look forward to your input. And I think all of us know Terry Cole. If you don't, well, you should. She is the president and CEO of the Greater Albuquerque Chamber of Commerce, longest-serving chamber CEO at one chamber in the United States. Terry, thank you for joining us. Appreciate it. I would read more of your bios, but we're short on time, so I'm going to try to cut a little bit out and save some time for us. Why don't you guys start us off and talk to us about medical malpractice laws and how they're impacting on the New Mexico economy.
Certainly, Mr. Chair, thanks for allowing us to be here. Jeff Crosdell, I'm with the Rohde Law Firm. I've done medical malpractice, as you mentioned, for 25 years. The original purpose of the Medical Malpractice Act back in the 70s was to handle a crisis of lack of providers. There worked for a number of years. There were some functional changes in 2017 where the hospitals started to become admitted as qualified healthcare providers. That both increased the stability of the patient compensation fund and increased the opportunity for providers to come into the state. Senator, I believe a lot of comments about the plaintiff's attorneys, there was a fix in 2021 to the Medical Malpractice Act. And the fix that was made was to make it more money.
Can you turn on your mic? I don't think.
I'm sorry.
That's all right.
The fix that was made is to make it more money available to plaintiff's attorneys. It increased the caps. It increased the ability to bring lawsuits. It increased definitions of occurrence and punitive damages. And one of the things Senator Woods suggested the hospitals were pulling out. The hospitals are not pulling out. They were actually forced out through that change, that the hospitals were slowly phased out. And in 2027, I believe the hospitals will not be allowed to be qualified healthcare providers under the act. And the result of this is that doctors are leaving New Mexico. They're either they're leaving, they're not staying, or they're not coming here in the first place. I know personal stories of several doctors who have retired or moved to another state. I know one who is practicing in Alaska while his family lives here. He flies to Alaska for a couple weeks at a time. And these are economies of scale when you think about it. If you have an opportunity as a doctor, there are fewer and fewer doctors graduating. And so if you have an opportunity as a doctor to go work where you can make more money and have a better healthcare system for your own family, you're going to take that. And that's the challenge that we face in New Mexico, is a lot of the doctors, our medical malpractice rates are high enough that money off the top that the doctors can make. If you can make $50,000 more in Colorado than New Mexico, you're going to practice in Colorado. The cost of defense has gone up as a result. It is now, to take a case through trial, about $1 million from start to finish. And a lot of that has to do with experts and the cost of experts. But we have a number, I know it was mentioned, we have a number of out-of-state plaintiffs' lawyers. And that's one of the things I think you can tell about New Mexico and why the system needs to be fixed, is the number of out-of-state lawyers that are coming here. Even Joe Cervantes is now with an El Paso law firm. Although he's been in Las Cruces for a very long time, he is associated with an El Paso law firm. But even Ron Bell, who many of us grew up, Ron Bell's law firm sold out to an Indianapolis law firm. A lot of the billboards you see are actually out-of-state law firms. Lerner and Rowe, Keller and Keller, those are out-of-state law firms. And why do they come to New Mexico? Because they know they can make a lot of money. And so there's increase in the OC, increase in lawsuits just in terms of who has been filing. It used to be a small subset of lawyers that were skilled in medical malpractice. And now we've become the new slip and fall or the new car crash. There's probably almost as many medical malpractice cases filed as there are car crash cases at this point. And what is lost in a lot of this is the personal effects on the provider. I have sat with many a provider who believed and truly and were willing to go to trial on the idea that they had done nothing wrong. And I'm willing to back them up on that. And what we get because of these lawsuits, it also affects the medicine that's being practiced. What our Madam Secretary called it defensive medicine. I think it's actually called I call it nervous medicine, where they order more tests, where they do more work because they're afraid of getting sued. And so I have a very unique, I think, perspective of this, but it's a problem and it needs to be fixed.
Mr. Chair and members of the committee, thank you very much for the opportunity to share my thoughts on behalf of my organization relative to how the medical malpractice laws in New Mexico are affecting our economic development and, even more importantly, our competitiveness as a state. So I want to speak to three areas very briefly. First, it's the challenge we have, and secondly, I want to share the impact, and then thirdly, the vision from the business community about how to correct the problem. So from a challenge perspective, the malpractice crisis that we're facing looks like this. To the average person, the term healthcare means one thing. Can I find a doctor when I need one? Can I get into a specialist without waiting for months? Can I get a test or outpatient procedure within a week or two? Can I keep my primary care doc for more than a year before they leave and I have to search for a new one? And so, if New Mexico is an inhospitable place to practice medicine, healthcare for New Mexicans will suffer. I've led the chamber for 4 decades. Never before have I seen access to a physician become the economic development issue it is today. Businesses already in New Mexico are frustrated. Premium costs to provide insurance coverage to their employees rise dramatically year after year. And yet, their employees can't get the kind of basic access to tests and doctors that they're paying for. So let me move to the impact, how it's hurting our competitiveness in New Mexico. And keep in mind, businesses not in New Mexico, but exploring whether to come here, are asking as many questions about this issue as they are about crime and our quality of schools. I remember 15 years ago, Mr. Chair and members of the committee, the number one issue we dealt with as an obstacle was economic education reform. About 7 years ago, we began dealing with another number one issue, which was public safety. And about 4 years ago, it became healthcare. Now, if we had been solving education reform, solving public safety, and now we deal with a new issue, okay, life's hard and we meet our challenges. But Mr. Chair and members of the committee, New Mexico, with respect to competitiveness, is now dealing with all three. Companies want their employees to be able to be healthy, to be able to schedule appointments when they need it, get preventative tests and screening, have reliable primary care docs, and see specialists quickly when something serious may be wrong. Our physician shortage is real, and those who try to minimize it are whistling past the graveyard. Our medical malpractice laws are tilted in favor of plaintiffs, attorneys, and against our physicians. But physicians can choose to practice elsewhere, and they are. Who can blame them? For those of us still here, we are the ones paying the price. So, the vision we have is simply, and it's not simple, I understand, but nevertheless, we think the solution is simple. We want a competitive, fair system. All we want is balance, fairness, and competitiveness with other states. That's how we approach regulatory matters. You've heard from me over the years about tax matters, and in this case, medical malpractice laws. It shouldn't be easier to, or more encouraged to sue a doctor than elsewhere. Caps should be reasonable and not threaten doctors' insurability. And attorneys' fees should be limited. So our mission is to make our city and state a great place to grow and a great place to bring new employees and tourists here. Can you imagine running a private medical practice here or serving as a doctor at one? When special interests outrun common sense, we get the situation we're in now, where New Mexico is simply not a competitive place to practice medicine, and people lose true access to the kind of health care they deserve. The kind that many businesses and frankly taxpayers pay for. So those are some comments I wanted to share with you. And again, Mr. Chair and members of the committee, I appreciate the opportunity to do so. Thank you.
Thank you, Terry. We're going to start with Nicole, Senator Tobiasen.
Thank you, Mr. Chair. And thank you both for your comments. Mrs. Cole, you said something that I think is critical for everyone to understand, and it's one word, it's balance. As a business coach, I have coached both doctors and attorneys for almost 20 years, among other business owners. Name the business type, and I've probably coached that business type. But we're in a climate now where there is such a lack of balance when it comes to especially a private practice physician. It's unthinkable. And I'll echo what Senator Thornton said, which is actually we have 75% of our medical school graduates leave the state for a brighter future, for a better life for themselves and their family. And it's statistically impossible to think that that void is filled by every bad and egregious doctor on the planet who chooses New Mexico. It's just not the case. It's ludicrous. That argument is absolutely false. And Mr. Crosdell, what I've learned about punitive damages, and I'd like for you to speak on this in particular, that is part of where this imbalance comes from when it comes to being a private practice doctor in particular here. So could you explain the definition of punitive damages and then the burden of proof in a court of law?
Certainly. Mr. Chair, Senator Tobiasen, punitive damages in New Mexico, actually, if you look at us nationally, we're one of the few states that allow punitive damages at what's called the lowest level of burden of proof. Standard burden of proof in a court of law is sort of the balancing of the scales, a preponderance of the evidence. Most states, if they allow punitive damages at all, require a clear and convincing evidence rule. So it has to be higher. You have to tilt the scales a little bit more. And one of the things that punitive damages allow in New Mexico is they allow systemic arguments. We have what's called cumulative conduct. And so someone can come in and say, look, there were numerous mistakes made. It's cumulative conduct. It shows that this is not a safe hospital or this was not a safe provider, leading to ludicrous punitive damages results in many, many cases. And so because we have such a low standard, because we allow it at all, the other thing about it, it makes it easy to get. The other thing about it in terms of our Medical Malpractice Act is that's where plaintiffs' counsel is going to make their money. The Office of Superintendent of Insurance has taken the position that they won't pay out a lump sum for future medical care at this point. That wasn't always the position, but that cuts into the lawyer's money because there isn't a big check. And so the lawyers have to push for punitive damages because that's how they're going to get their money. And so every case, even simple negligence cases, become punitive damages cases in an effort to make money.
Thank you for that explanation. And can you describe malice for us and how that comes to play in a court of law with a doctor?
Certainly, the lowest standard that is applied under the rules is something called the reckless standard, which is the intentional doing of an act with utter indifference to the consequences. I've heard it described as shooting a gun into the air and not caring where the bullet may come down. That is, you make the intentional act of shooting the gun, but you don't really care if someone gets hurt. And so that's the standard. And you think about New Mexico at New Year's, how many people fire a gun into the air? It's a pretty low standard, but that's the standard for the lowest standard for punitive damages.
And thank you for that. And I think this really speaks to one of the foundational issues that have to be resolved within our legal system here. Otherwise, we're pushing mud uphill if we don't address this aspect of what doctors are dealing with in a court of law. So I thank you both for your comments today. Thank you, Mr. Chair.
Thank you, Senator Woods.
My question's been answered. I appreciate you bringing that out, because those punitive damages is the exact driver that's taking the livelihoods and the houses, and they're not covered by anything else. It's a personal liability to someone that gets that against them. And why would you risk your house, your kids' education fund, anything else in the state of New Mexico when you could practice in another state without that? So thank you. Thank you very much.
Senator Block.
Thank you, Mr. Chair. Jeff, I like you. You're one of the lawyers I like. Thank you. Terry, you said the word balance. Let's talk about balance for a minute. You know, for 8 years, I sat up here with, I see our former chairman, Dave Heil there. And we focused a lot on economic development, which I think you do too, as a Chamber of Commerce. If you're not doing that, you shouldn't be in the position. Right. Balance. You talk to site selectors, Terry?
Mr. Chairman, Senator Block, of course.
So when you talk to site selectors, they talk to you about, you're trying to sell New Mexico, right?
Mr. Chairman, Senator Block, yes.
Because all you care about is making sure we have good jobs here and people have safe streets and good health care and good schools and good infrastructure and a pro-business tax code. Did I qualify for a job at the Albuquerque Chamber of Commerce?
Mr. Chair, members of the committee, I was just telling you you'd be good at my job with all that.
Well, I learned a lot sitting up here for 8 years, focusing on economic development here in Sandoval County and Rio Rancho is the fastest growing county and rated the #1 city. And I look at the mayor back there of Rio Rancho, and he's waving to me with his thumb up, and he's all just, there he is, he's all smiling. Best place to live in New Mexico, by the way, Rio Rancho and Sandoval County. How important is healthcare access to your site selectors? They talk, just quick yes or no, they talk about that?
Mr. Chair and Senator Block, yes, absolutely,
Okay.
more so today than ever.
Great. And we're one of the worst states for healthcare too, by the way, right, Terry?
Mr. Chairman and Senator Block, absolutely,
Okay.
we are.
Gotcha. Want to be quick here.
Yep.
Before Senator Brandt punishes me.
Yep.
How important is crime and public safety in your job talking to site selectors?
Mr. Chair, Senator Block, absolutely at the top of the list.
And you're the president and CEO of the Albuquerque Chamber of Commerce, one of the most dangerous cities in the world, are you not?
Mr. Chairman, Senator Block, yes,
I think it
indeed.
was ranked about 20th most dangerous city in the world. And I've been to Kabul, Afghanistan. I felt safer in some areas of Kabul than some of the areas down in Albuquerque. How about education? Do you guys talk about education to your site selectors?
Mr. Chair and Senator Block, yes, we do, because we're asked questions. They
And
already
what do you say?
have
Do you say we're
information.
last in the nation in education? We're doing that good?
We're 51,
51 out of 51, right?
correct,
Including Washington DC?
correct,
That's 51 bad, not 51 good, right?
correct.
Okay. How about infrastructure? Worst roads in the country. You guys talk about that?
Mr. Chair and Senator Block, yes, I would tell you that education reform, public safety, and medical malpractice laws / healthcare are at the top of the list, but transportation makes it.
Okay. Real quick, two last ones here. How about the tax structure with this GRT scheme here? Is that a real good thing to have when you're talking to your site selectors?
And Mr. Chair, Senator Block, it hurts us in our competitiveness area. We just don't compete as well with our GRT.
Well, let me tell you a little bit about what we do here in Sandoval County. And I also have Northwest Albuquerque, which I love dearly. We got two great hospitals here, SRMC and Rust. We are the safest, and the governor was here when we opened up our emergency ops center or something like that. And the governor said Sandoval County is the safest county per capita in the state of New Mexico. You probably knew that, though. And we have one of the best education systems here in Rio Rancho. You probably knew that as well. And we also do a great job. Those are positive ingredients of attracting businesses to Sandoval County and Rio Rancho, which I think the entire state of New Mexico should use our model. But when it comes to healthcare, is that one of the top 2 or 3 things companies are looking at when it comes to the healthcare? Because they want to take care of their employees and their families. Is that fair to say?
Mr. Chair, Senator Block, it is now.
It is. So what do you tell them, like about New Mexico healthcare system? I mean, I would imagine law firms that are personal injury attorneys or these medical malpractice attorneys. I mean, this is like, this is heaven for them. But when you're talking to site selectors, what do you tell them about our healthcare system?
Mr. Chair, Senator Block, we try to focus on what are we doing about it rather than how bad
Well, the answer is
it
nothing,
is.
Terry. The answer is nothing because we can't get anything done.
Well, Mr. Chair and Senator Block, I appreciate the challenge, believe me, and you're absolutely right about how hard it is. But from a perspective of being a professional and the job I'm trying to do, and because I'm talking to business CEOs, they care about how are you trying to solve the problem. And so that's what I try to focus on in answer to your question.
Yeah. Well, let me just close by saying it's real nice to be professional, but you know what? The niceties are over. It's time to really tell the truth to the New Mexico public and those that are hurting. And I would love to make your job easier, as of every other senator up here, and Senator Gallegos right there, and Representative Cullen right there. We would love to make your job easier, where you can tell site selectors, come to New Mexico. You're not going to believe this, but man, you can go to the doctor tomorrow, not next June. Boy, wouldn't that be a great state to live in, Terry, wouldn't it?
Mr. Chair and Senator Block, absolutely.
Well, thank you. And Jeff, I really like you. I haven't met you before, I don't think, have I?
No, sir.
But I like you.
Appreciate
And thank
that.
you for what you're doing. And Terry, thank you for pushing Albuquerque. Thank you for pushing New Mexico. We want more people here. What a beautiful, beautiful state we have with incredible people. And unfortunately, they've just been trampled over by these trial attorneys that are destroying our state. Thank you, Mr. Chair.
Thank you, Senator Block. Really appreciate it. Jeff, I really appreciate you bringing out that a lot of our longtime lawyers firms that many of us have watched on TV for, years and years. I've been here off and on since 1987. And, I can give you the bell jingle and all those things, but now they're owned by out-of-state companies. And that what you said, the largest ones are owned by the out-of-state companies?
Mr. Chair, that is correct, that a lot of the out-of-state companies have come in and bought the image of those folks who we all know.
And what I want to bring out about that is that those folks that have out-of-state companies, they don't care about whether we have good medical care in New Mexico. They're out of state. They're in Indiana where they can get good medical care, or they're in Texas where they can get good medical care. They don't care whether we can. And they're the ones that are given all this money. On everything you look at, you can always say, follow the money, right? Follow the money, folks. Where's the money going from the trial attorneys? Because, Jay, I want to tell you, you don't have to worry about losing any contributions. They weren't going to give you any anyway. So just want you to know that. That is not something you have to worry about because the trial attorneys don't give money to us because we actually care about the medical care of our constituents. I care when I have a constituent call and say it's going to take months to get in to have a test they need to have, and it's a life or death situation. And I get to tell them, I'm in the same boat, and you probably ought to look at going to another state to get that done. But I want to bring out again that we keep getting told that they care about the minorities, and they care about the poor, and they care about all these folks. Those are the folks on Medicaid who legally Medicaid won't pay if you go to Texas and get care. They only pay for in-state care. Yet those folks can't get in-state care because we've made it so hard for doctors to practice in New Mexico. So when they're telling you how much they care, let's just be honest, they don't care. So thank you both for coming. Terry, I know you know, and we've talked many times about how this affects the economy in New Mexico. I'm glad but shocked that we have a company coming into Sandoval County. Every time there's a big company announcement that they're coming to New Mexico, it shocks me, to be honest with you. Because I'm trying to figure out how are we going to provide the medical care for their employees, and more importantly, their employees' families. Because that's where it hits, is the families. So thank you very much. Appreciate both of you being here. Next up, we have, we're going to hear from some patients. Pat Gillick. Sorry, how do you say your last name? Gillick. If you can come up to the table, and we're going to hear from Kathy Stark on a video here in a minute, and Sherman McCorkle. Pat, thank you for being here with us.
Thank you for having me.
Brandon, do we want to start with the video, or do we want to start just from the top and go down? Okay, Pat, we're going to start with you.
Okay. Well, good afternoon, and thank you for the opportunity to speak today. My name is Pat Gillick. I'm here as a patient who has lived the impact of New Mexico's healthcare access crisis. My wife and I moved here from North Dakota when I retired in May of 2022. We did our research carefully, looking into climate, politics, crime, recreation, and housing costs. Obviously, coming from North Dakota, our climate was our favorite. It's not hard to improve on North Dakota's climate. We found a lot of things we wanted and felt that we could live with some of the things that we didn't. We built our dream home in Rio Rancho and made wonderful friends and fully expected New Mexico to be our forever home. What we didn't research and what we wrongly assumed would be fine was healthcare access. We thought that with good insurance, healthcare and getting healthcare wouldn't be a problem, and we were dead wrong. In just 3 years here, both my wife and I tried to become established with primary care providers. Each time we had an introductory appointment, we later received a letter in the mail stating that our new physician had left the practice and there were no replacements accepting patients. We searched everywhere, calling hospitals, clinics, even our insurance company. My wife spent 2 fully paid vacation days doing nothing but calling and came up empty. Friends even tried to pull strings for us, but that didn't work. The closest we came was the University of New Mexico Medical Center, which offered to put us on a waiting list last December. They estimated it would take 2 years just to get off that list, and then another 7 to 9 months before we'd actually be seen. That's essentially a 3-year wait for a primary care appointment. When we discussed the issue with our insurance company, they could only offer one solution. They told us that if we ever needed routine specialty services like a colonoscopy or mammogram, to go to an emergency room and request a referral because the ER would have to comply. And since my father was a physician, I want to tell you, all of you here, that I would never follow that advice. Emergency rooms are for emergencies, period. My insurance company's advice sounds ridiculous because it is, but that's where we are in New Mexico right now. Imagine what would happen to our emergency room traffic statewide if everyone decided to follow that advice. My wife and I are 56 and 59, respectively. We're not in our 20s like Senator Block anymore. We're in good health, but at this stage of life, proactive care is critical. Early detection saves lives, and in New Mexico, it simply isn't possible. That reality forced us into one of the hardest decisions of our lives, putting our dream home on the market and preparing to leave the state we love. And this just isn't just our story. We've met friends who drive to Colorado or fly to Arizona and New York for basic care. One of our neighbors is an ER physician, and he gave up trying to practice here, and he now flies his family to Texas for health care. Another neighbor who developed cancer had to move back to New York just to have a fighting chance at survival. And we know of physicians who left New Mexico entirely because malpractice insurance costs driven by unlimited awards made it impossible to stay in practice. Meanwhile, my wife and I flew to Arizona, and the difference was striking. We saw a doctor right away. When follow-up tests were needed, the clinic arranged them the very next morning. In New Mexico, that would have meant months of waiting. And this is more than just an inconvenience. It's a crisis that drives patients away and prevents physicians from staying. My wife and I are in the kind of residents New Mexico should want. We're active in our community, we're taxpayers and net contributors. We don't draw on public services, and we give back to the community financially, socially, and civically. People like us strengthen the state, but if we can't reliably access health care, we're forced to take our energy and resources elsewhere. And we're not the only ones. Our friends often say, let us know where you end up. We've been thinking a lot about this too, and we may be right behind you. I strongly believe that medical malpractice reform, putting reasonable limits on awards, is necessary if New Mexico wants to attract and retain physicians, and if patients are ever going to have access to timely care. Without reform, we're going to continue to see people and doctors alike leaving the state. I don't envy the task you have in front of you, as I know the forces you're fighting against. Unlimited malpractice awards are sometimes sold as a noble cause, but if the result is fewer doctors, longer waits, and families leaving the state just to get care, then it's not noble, it's destructive. It's self-interest disguised as public good, and patients like us are the ones who pay the price. Thank you again for your time today and for giving me a chance to tell my story.
Thank you so much, Pat. Appreciate it. Sherman, why don't you go ahead and go, and then we'll listen to the video. Thank you.
Thank you, Mr. Chairman. I'm a volunteer with the Kirtland Partnership Committee. The purpose of the Kirtland Partnership Committee is to protect, preserve, and grow the Kirtland National Security Complex. I'm also a member of the New Mexico Military Commission to help the other bases in New Mexico. Let me talk about Kirtland for just a moment. 108 military, distinctly different military missions on Kirtland Air Force Base. The National Nuclear Security Administration on Kirtland has 58 distinctly different missions on Kirtland Air Force Base. In February of 2018, the Secretaries of the Army, the Navy, and the Air Force sent a joint letter to all 50 governors urging them to enhance their state support for military families. These senior leaders called out states to prioritize robust healthcare accessibility for military personnel and their families. New Mexico's long struggled with doctors. In fact, in 2021, data showed that 4 out of 5 counties in New Mexico fell short of the recommended 8.5 primary care practitioners for every 10,000 residents. The Serio Institute further highlighted the severity of the problem, identifying that 32 of the 33 counties as being in urgent need of additional primary care physicians, with only Los Alamos County meeting the necessary benchmark. The situation has worsened greatly since 2021, when the state legislature enacted the highest malpractice caps. So since then, 248 physicians have left practice in the state of New Mexico, since the secretaries of the services asked New Mexico to provide better health care. The heightened financial and legal uncertainties have left all these physicians to reconsider their commitments. For several years, the Kirtland Partnership Committee has championed legislation to enable New Mexico to join the IMLC, the compacts. As has been talked about, the opposing side is the New Mexico Safety Over Profits, made up of the plaintiff attorneys. Perhaps we should create a nonprofit that is healthcare over trial attorneys. Currently, it's estimated that 1 in 4 planned military transfers to New Mexico does not occur due to concerns about inadequate health care. All 3 New Mexico military bases are in the Air Force's top 15 rejection rate under dependent travel not advised. All 3 of our bases are in the Air Force's 15. There's 148 Air Force bases in the 50 states. Clearly, the compacts in and of themselves will not solve it. We must do something about the malpractice. When 1 out of 4 military transfers failed to take place because of concerns about inadequate health care, we can imagine what it does with national security. Let me just expand for a moment. In New Mexico, we have White Sands, we have Holloman, we have Cannon, we have Kirtland. 90% of Fort Bliss is in New Mexico. In those Department of Defense, that's 28,000 jobs. And the total economic benefit is $16 billion. That's the Department of Defense. National Nuclear Security, we have the Carlsbad Field Office, we have the John A. Goodwin Complex, we have the Los Alamos Field Office, we have the KC National Security Complex, and we have the Sandia Field Office. That is 30,000 direct jobs. And it's $10 billion in economic impact. We add that together, that is 60,000 jobs in New Mexico. Most of them among the highest paid jobs that we have in New Mexico. And that's $26 billion each year, economic impact in the state of New Mexico. And yet, we know 1 out of 4 in the Department of Defense fail to come to New Mexico. I spend time with the National Nuclear Security Administration, and I can tell you that the 2 laboratories, the job people that decline the jobs are because of health care, and health care. People can figure out a way to find an education for their children in New Mexico. People can figure out a way to find neighborhoods where crime is not as bad as other neighborhoods. None of these people can figure out what to do about health care, and so they simply do not come to New Mexico. Thank you.
Thank you, Sherman. Thank you, Pat. We're going to listen to a video real quick by Kathy Stark in Las Cruces. She's co-founded Patients Primero, and it's a group of over 200 people that she's put together to advocate for healthcare in New Mexico.
Hi, thank you for inviting me to talk to you today. My name is Kathy Stark, and I live in Las Cruces. I am also the co-founder of Patients Primero, which is a nonpartisan group of citizens advocating for improvements to access to healthcare throughout the state of New Mexico. Most of my friends will tell you that I enjoy talking to people. I'm usually energized and excited about something. But admittedly, I am growing increasingly very sad, and I'm going to tell you why. I'm going to give you some stories of some real life people and the impact that our health system is having on them. The first was a gentleman in the emergency room in excruciating pain. The hospital did blood work, they ran scans, and determined what he needed was an IR specialist. They didn't have one. They called hospital number 2, who refused the patient, stating they didn't have a bed. What that generally translates into is that there's a staffing issue there. The first hospital tried a different intervention, which was not successful, so they called the third hospital, who agreed to transfer the patient there because they had an IR specialist. What's the problem with that? That was 9 days later. Think about that. In the past couple weeks, I will also tell you, I've heard from an additional 4 people who are selling their homes and leaving the state of New Mexico, citing healthcare access as the major reason that they're leaving. These are our friends, our colleagues, our neighbors, some of them family members. They're taxpayers, they support local businesses, but they feel like they need to leave New Mexico. Patients Primero has an ongoing poll, and in that poll, 44% of the people who responded said they know somebody who's left the state because of the lack of access to health care. Another 35%, know of someone who didn't move to New Mexico because of the lack of health care. Think about that. Another example, a gentleman living in a rural community northwest of Las Cruces was not feeling well, so he made an appointment and went to see his primary care provider, who was a nurse practitioner. He had critically high blood pressure that the nurse practitioner had never seen anything that high before. He needed a cardiologist. The nurse practitioner said this was way beyond her training and put him on a waiting list for a cardiologist. What's the problem? The wait list was 12 months. This gentleman's son has made 20 trips taking him to appointments because he developed ocular damage. First appointment was with an optometrist who said, this is beyond me, you need to see an ophthalmologist, who said, this is beyond me, you need to see a specialist in ophthalmology. As a consequence of that delay, this gentleman is now blind. This is a lifelong New Mexican who will now tell you how sad he is that he will never see his grandchildren. When I talk about nurse practitioners, I don't mean to degrade them. They have a role to play. But I want you to think about this gentleman's situation when you read the legislative finance report on the healthcare workforce, where they say that by 2030, when the shortage of physicians is even greater, nurse practitioners can be used to fill that void. These are just a few of the stories I hear every week that are making me increasingly sad. The system in New Mexico has failed these people. None of them blamed what happened to them on the physicians, but they do blame it on the lack of access to primary care and specialists. Did you know there are more neurosurgeons in Lubbock, Texas than there are in the entire state of New Mexico? Think about that. This isn't a new problem. It's been growing for years, and the legislature has known it. If you want to listen and learn about solving a problem in a specialty area, who do you talk to? You talk to the specialists. Legislators need to be talking and listening to the physicians because that hasn't been happening. I believe, and Patients Primero believes, that all New Mexicans should have access to quality health care. And the lack of physicians is the key barrier to achieving that healthcare system. We believe that patients who are harmed, and it does happen, need to be fairly compensated, but they also need to not be put at risk because of lump sum payments that run out and high attorney fees. At some point, I've heard that the problem is private equity. In my opinion, private equity is the result of a system that does not support independent and non-private equity-owned hospitals and clinics, forcing doctors to close their doors and sign on with one of the private equity-acquired hospitals and clinics. As a resident of New Mexico for 27 years, and I love it here, I have family here, to be really honest, I have started looking at property in other states because I need to know that I have access to health care when I need it. So I cannot urge elected officials enough to tackle the complex challenges in healthcare and create a balanced system that will serve all the people in all the parts of New Mexico, and do it now because we are in a crisis. Thanks very much for listening.
Thank you to Kathy. I know you guys are listening down there. They have a big party going, listening to us. And so thank you for sharing that with us. Sherman, I just want to touch a little bit on the base issue. I really appreciate the fact that you brought up the $26 billion. To me, it's a real concern about our national security as a state and as a country that New Mexico, I mean, I was stationed originally at Kirtland Air Force Base. That's where I started my career. And I can't tell you what I did because I'm just not allowed to. But we have some real critical missions at that base that if they were, I mean, do you think that we're at risk at some point in the future, if this continues to get worse, that they will consider moving our missions elsewhere?
Mr. Chairman, unfortunately, the answer is yes.
I appreciate that. That's one of my concerns. I don't know that New Mexico could survive if we lost our bases. I don't know that New Mexico could survive if we lost our bases in Sandia National Labs, which is on that base, on Kirtland Air Force Base, not to mention the Air Force Lab that's on that base. So, and I think if the base went, both of those would go elsewhere as well. I don't think they would stay. I think there's serious concerns I've been sitting up there I've been sitting in Santa Fe for 13 years. That's about 12 years too long. Keep telling Terry, Terry talks about the stacking. We were working on one emergency. I remember each one of those. And you're right, we never solved the first one. And now we've got to solve three things that we're in crisis for in our state. And we cannot get a consensus together, a group together on both sides of the aisle to get this issue solved. Any of those three issues solved. But you're right, Sherman. Sorry, I didn't mean to call you Sherman. Sherman, with these issues, at the level that these jobs pay at, they can probably take care of the education situation. And they can all move to Rio Rancho. They don't have to be rich to move here, and we're a safe community. So the safety we can take care of. We can take care of the education with Rio Rancho Public Schools and some of our charter schools up here. But what they can't take care of by moving to Rio Rancho is health care. Because we can't attract them in Rio Rancho any greater than they can attract them in Albuquerque. Because the situation is a statewide situation. It's a statewide crisis. So does anyone have any quick questions? Because we're over time. So go ahead.
Thank you, Mr. Chair. Just wanted to make a couple comments regarding first, Pat. I'm glad you came from North Dakota.
Yes.
I know that was an easy choice to come to New Mexico. However, I really am sorry to hear that you guys are having problems with the access. I know for a fact that, and this was the story I was going to tell earlier. My wife is from Texas, and I met her in Fort Worth, and we were getting married, and we found out probably a couple weeks before we were going to get married, she found this small little spot on her inner thigh. And she thought, this doesn't look right. I've never seen this before. So she actually went in on a Tuesday and had them do a biopsy. On Wednesday, they called her and told her that it was melanoma. They had her in on the operation on Thursday, and they removed a large part of her leg because it was right above her lymph nodes. And had she waited probably even a month, I wouldn't be married to her now. She'd probably be dead. So I understand how important it is for access and immediate access to care. Time makes the difference. And so we have to fix this problem here in New Mexico. And I'm concerned because I know for a fact we're not seeing that. And as for Mr. McCorkle, I appreciate all the work. I know you for years. You've been very involved with Sandia Labs. I worked there for 27 years as an aerospace engineer. And I understand the missions of the laboratories and what they do and how important they are to the nation. Most of the people, 90% of the people in New Mexico have no idea what Sandia brings to the table for the national security of this country. And if we cannot give medical care to those employees at Sandia, at Kirtland, I could see those missions going away as well. And so it's important for us to understand that, as Terry Cole mentioned, this is an economic issue as well. We've got to be able to keep the businesses here, not only allow bringing other businesses in from outside, but keeping the businesses we already have. And so I'm glad you brought that up. I appreciate that. And so thank you very much for bringing that forward. You said 1 in 4 transfers who have an opportunity to come to New Mexico choose not to. I don't know why my phone is talking to me right now, but. And so that we're in the top 15 of the sites that they don't want to come to, and you're saying it's primarily because of medical care. That's an issue. And I think it's something that I'm glad you mentioned that, because it's important for us to understand that if service people have already heard about the New Mexico's problems and they're choosing not to come here, they're rejecting New Mexico because of the medical care problem. That's something that we as legislators need to address. That's a very important part of our business. We are a national security state, whether you like it or not. And we need to understand that. And in order to continue to promote that, we need to address that issue directly. So thank you very much. I thank both of you for you bringing these two issues together and bringing this forward. And hopefully we can work those issues going forward. Thank you very much.
Thank you, folks, for your
Mr. Chairman, if I may, just Senator Thornton, there's a lack of understanding in our state It was 2018 when the service secretaries wrote the letter. It has been tracked now for 7 years. Given the current reality, we are a blue state with a red administration in DC. And this is the kind of situation that just creates the opportunity to move literally thousands of jobs.
Thank you, Sherman. Appreciate it. Jay, real quick.
Yeah, thank you, Mr. Chair. Pat, we hate to see you and your wife, who I've gotten to know, leave to Arizona. You guys are great New Mexicans, and I hope things can change where you guys stay. And really, real quick to Kathy, just all too common story. And to you, Sherman, you bring up a really good point, because we haven't had a BRAC for a while. And for those of you who don't know what BRAC is your base realignment committees. And basically, DOD takes a bunch of people, or a group of people, and they go around, they figure out what your missions are, what your issues are, and whether or not you can go. Kirtland was on the BRAC a few years ago, but it was saved. And one of the things that I think is always going to help Kirtland Air Force Base out, I'm not going to get too much into it, but is the 898th Munitions Squadron. That is something that is going to keep always a footprint of our nuclear mission at Kirtland. But when you look at some of these Air Force bases like Grand Forks in North Dakota, Minot, North Dakota, F.E. Warren, Cheyenne, Malmstrom, Great Falls, Montana, those are bases, granted they have, especially Minot, Malmstrom, and F.E. Warren, Minuteman III ICBM bases I've been to. But for Cannon and Alamogordo, it's real easy, Sherman, to have the Air Force go find other bases to go fly and train for F-35s of what they're doing in Holloman. We got great airspace here in New Mexico, but when I talked to the vice wing commander at Holloman, when you go through undergraduate pilot training at Luke, and then you're coming for F-35 follow-on training, that's 9 months of training. By the way, a PCS is 179 days. If you're 179 days, you PCS, but a lot of these pilots aren't taking their families here for F-35 training. That's a huge issue. The Air Force can go over to MacDill in Florida, and they can go fly, because they have much better health care there in New Mexico, and that will kill Alamogordo if we lose that huge mission down at Holloman. So who's ever paying attention, we are really, really in danger, in my opinion, if a BRAC happens, of losing 2 bases in New Mexico. And it's going to kill Senator Woods' area. You can just kiss Clovis goodbye, and you can kiss Alamogordo goodbye. Gone. Because just the ridiculously of this state and its policy regarding medical malpractice. Sherman, thank you for what you do. Thank you, Mr. Chair.
Thank you, gentlemen. We're going to move on to our next presenters, which we have some medical practitioners. Dr. Debbie Vigil, independent physician, OBGYN. Dr. Vigil is a 20th generation New Mexican born in Santa Fe, educated at UNM. Okay, apparently we're not being loud enough, so we got to speak into the mics a little bit more, us and the presenters. So, all right, I'll try to start. Is that better, Brandon? Okay, all right. We have Dr. Barbara McEnany. Did I get that right?
You did.
I did. I thought I'd heard it several times. Dr. Bill Ritchie and Dr. Michaela. Is Dr. Michaela here? Is that the one we're not going to have today? Okay. Well, we'll go forward with you three. Thank you for being here. Talk to us about your perspectives as providers. It'd be great is, tell us why you're still here and haven't gone to more fruitful pastures.
Well, that's pretty easy for me to talk about. Can everyone hear me? First of all, thank you very much for inviting me to be here today and to give me a voice, coming from someone who has served in my capacity for a number of years and can share my experience with you. I was born in the Drury Hotel in Santa Fe, which is otherwise known as the Old Hospital. That probably ages me, but so it is. I grew up very close to my extended family. I grew up very close to my grandparents, and I had fun going to my grandparents' appointments when they were going to their doctors. And that is what drove me into medicine, and I really, really wanted to come back to New Mexico and serve the people from New Mexico. And we've heard about Kirtland, and we've heard about a variety of places, Clovis, you name it, in New Mexico. And my dream was to come back to northern New Mexico and serve all the people from all over the state. But of course, because I set up practice in Santa Fe, I served primarily northern New Mexico, but I touched families from the reservations, from Kirtland Air Force Base, from small communities all over the state. And I also served the very rich and famous that come to Santa Fe and live there. I've served the very poor, I've served the very rich, and everyone in between. So I have a pretty good idea of what we have in New Mexico. And I have been proud to have practiced here. I set up a solo independent practice back in 1989, which no one does anymore, by the way, because most physicians are employed. It is very, very expensive to run a practice, especially as an obstetrician. I loved my practice. I loved my patients, and I still love my patients. However, running a practice in New Mexico was always a challenge. We had gross receipts that we had to pay. We didn't get to pass that on to the insurance companies. We didn't get to pass that on to Medicare, Medicaid, and certainly not to our patients. So we basically ate it. I'm very familiar with the expenses because I ran an independent practice and I ran it by myself. We always had reimbursement issues, Medicare, Medicaid, poorly reimbursed. I can't tell you how many times patients moved from the East Coast and the West Coast and said, why is Medicare such a big deal in New Mexico? Well, what a lot of people don't realize that Medicare reimburses physicians in New Mexico lower than other states. Most people don't know that. And insurance companies, when you go to negotiate what they're going to pay you, I think most people know that if you send a bill to an insurance company, you're not going to get paid what you billed them for. You're going to get paid what was negotiated. And so basically they use these Medicare numbers to negotiate what you're going to get paid. These were ongoing issues in running a practice. But I love practicing medicine. I love practicing obstetrics and gynecology, and I loved my patients. That's why I stayed in New Mexico. When I finished my residency, I was recruited all over. I never stopped getting recruited from all over the United States. I am now retired for 2 years, and I'm still getting recruitment letters and calls. That never stops. Why am I here? Because I love the people from New Mexico. I am from here. My extended family is still in northern New Mexico. There are so many opportunities for physicians to go out and practice elsewhere. That's what they're going to do. If I were starting practice, as much as I love being here and as much as I love my family and as much as I'm rooted here, if I were starting practice today with what's happened, forget it. So here I am trucking along with my practice, taking care of patients, busy taking care of patients. Physicians don't really advocate well for themselves. They're too busy taking care of patients. That's what we do. So yes, I had all these, cost issues and trying to make ends meet with practice and making a living. and then try and be happy through it all. And I was. We always had problems recruiting. We always had problems retaining. 2020 came and we hit the pandemic. That was a challenging year for us providers. We were working hard. We were trying to figure out how to practice medicine with mandates of closing down offices, mandates of, we had all sorts of mandates that we had to comply with. But we survived 2020, then came 2021. We're still surviving. And my head was in taking care of patients. I'm not really a very political person. I don't keep up with politics. I do vote, but I don't spend a lot of time with politicians and certainly don't spend any time in the legislature. I had no idea what was going on in the legislature in 2021. All along, through all of my years of practice, I don't think I need to tell most people in this room that being an obstetrician, malpractice is a big, big deal. We get sued a lot, and when we get sued, payouts are big. We're talking millions. We're not talking a few $100s. What that does to a doctor, we're talking about money here today. How much it costs to pay for your premiums. We're talking about payouts to patients. We're talking about how much money lawyers make from these cases. Let me just bring up something that isn't always mentioned. Lawsuits are painful. Doctors suffer not only time away from the office from taking care of patients, their families go through hell when they get sued. They are scarred. Their careers will never be exactly the same. Doctors don't like to be sued, not only because of the financial part of it, but really, there's a lot that goes into it. Physicians are there to take care of patients, and they love what they do, and they pour out their heart and soul taking care of patients. So this is a painful experience. So bringing me back to 2021, I'm working hard. I get my bill the beginning of 2022 from my malpractice premium company. I couldn't believe it, so I thought it was a mistake. So I called my insurance company, and they said it's not a mistake. I made more phone calls, and I suddenly came to the realization that after all these years, when I heard rumbling that the trial lawyers were trying to push back on the reform that had taken place in 1970, when physicians could not get insurance in this state because insurance companies were losing money because of lawsuits, it came to such a crisis that we didn't have a way of insuring physicians in the 1970s. So in 1976, they came up with a solution. The policymakers came up with a solution. It wasn't perfect, but at least it allowed insurance companies to come back into the country, come back into the state and provide insurance for us. Because, by the way, as an obstetrician or any surgeon or anybody that works in the hospital, you cannot practice in the hospital unless you have malpractice insurance coverage, period. They don't want to, yes, 2 minutes. Okay, so in summary, this legislation took place, and I knew immediately it was going to do a lot of damage to the state and to the patients. It was obvious to me. Why on earth they did it when we already had a problem is beyond me. What I will say in conclusion, the only winners and the losers are as follows. The patients don't win in these cases. The doctors don't win in these cases. Even if the doctors win a case, they don't come away feeling like they won anything. It's painful. But there is one big winner, and that's the trial lawyer. And that's painful to think about because as I like the word balance that has been said a couple of times earlier. Yes, the lawyers deserve to get paid for what they do. Patients deserve to get compensated when something harmful has been done. But why are we here today? Because what's been done has not been balanced. And so it's a disaster now. And we've heard from numerous people as to why nobody wants to practice here and how it's affected a variety of entities in the state. And I hate to see that happen, but that's where we are.
Thank you, Dr. Vigil. Dr. McEnany?
Thank you, Mr. Chair in absentia, and the senators. Thank you very much for inviting me to talk. I am a medical oncologist, and I am the founder and CEO of New Mexico Cancer Center, which is the independent private practice that started out with medical oncology. And over the years, we have been very proud to say that if you call our practice and you need a medical oncologist, we will get you in within 72 hours. If you need a radiation oncologist, I can get you in within 10 days. But where this system falls down in my practice is in surgical oncology. And there are 4 pillars for what we do to treat cancer: chemotherapy, immunotherapy, radiation, and surgery. So when we're seeing a patient who needs surgery, we have to stop everything and see these long delays, because there are not surgeons in our community who are capable of doing the kind of oncologic surgery we need done. They're simply not there. We're sending people out of state all the time. So I thought, because in running the practice, what I would do would be I would find surgeons and I would incorporate them into my practice. And so I hired some urologists who left the hospital system they were working for and took a pay cut to join us for the independence and ability to manage their care. I hired an excellent general surgeon, Lisa Baldoff. I hired an ear, nose, and throat surgeon and kept trying to recruit surgeons. Then we started seeing the malpractice rates go from, for Dr. Baldoff, $70,000 a year to $110,000, and she'd had no suits. So what is this all about? And she was very much afraid of this and was considering whether or not she should stay. Part of the problem that we had to discuss was when the patient compensation fund admitted the hospitals in, and we went from $1 million surplus to first $15 million deficit, and then every year it dropped by another $15 million. When it hit $100 million, and people said, well, we are going to put a surcharge on the physicians of the community to pay for this deficit that I believe strongly was caused by the hospitals joining the patient compensation fund, that now I have 27 physicians. That would have been $100,000 a doctor. I do not have that kind of money. So I pulled out of the act. I said the cap is not worth it. Now, I agree strongly with the Medical Society that the cap is incredibly valuable, but it needs to be a meaningful cap like MICRA in California or Texas's cap. And I definitely support that, because I used to be able to recruit people to New Mexico, not just for our sunshine and the green chili, but for the good medical malpractice climate we had here. So when that came up and we had to look at that, I thought, why do I want to have medical malpractice insurance? If I or one of my physicians injures someone, I strongly believe that it is my duty to take care of that patient's further medical expenses and take care of that patient's livelihood. Someone shouldn't have to live under the bridge because of something we did. So we created our own medical malpractice system out from under the cap. And we incorporate a lot of the same things you're going to hear from the Medical Society of the importance of what's there. But we could put in my own system, I can put in a policy in a captive insurance company I created that will pay for future medicals for patients by buying them the best exchange plan on the market and paying the $5,000 deductible, so that if we injure someone, they will not have out-of-pocket costs, and they will have health care that they deserve. Furthermore, we put into our practice a disability policy, so that if I or one of my doctors injures somebody, we will kick in our disability policy. And the insurance companies have figured this out. You know, your right arm is worth this, your left leg is worth that. We can manage those things, and we can pay somebody so they don't have to live under the bridge. What I couldn't do was punitive damages. And so over the last couple of years, I have lost 3 surgeons out of my practice in an area where I'm still sending people out of state for surgery. I lost Dr. Baldoff, who came and said to me, my premiums have now gone up $110,000 a year. The surcharge is ridiculous, but I'm scared to death of punitives. I cannot put my husband's future, my children's their education fund at risk, and I don't want to be known as the doctor who brings down New Mexico Cancer Center. What do I say to that? I say, good luck in your new career. And she went to Colorado, another surgeon went to Florida, another surgeon went to Texas. I can't recruit surgeons back in, partly because of the economics of it, but a lot because of the fear of medical malpractice, punitive damages which you cannot insure against. They come out of your personal income, your personal house, your pension plan. And that is really something that we are all united on. That if I woke up in the morning and thought, you know, I'm really in a bad mood, I'm going to give somebody the wrong chemo today because I just want to hurt somebody, that's when you should give me punitive damages. But I have never heard a physician say that. Nobody wakes up wanting to do that. And guess what? People don't come to practice in New Mexico because they think they're going to get rich. They want to do the right thing for patients. And so we're working very hard to try to do that. I think it's time for us to look at all of those factors that make a difference. You know, we have a very sympathetic jury system. Maybe we should look at health courts. We have a patient compensation fund that's cost the taxpayers over $90 million. Doesn't work for doctors, doesn't work for patients for reasons you've heard before. Maybe we should think about out-of-the-box ideas like doing what I'm doing for my own practice and paying a premium to an insurance company. What we did in 1970s was revolutionary. We created an insurance process to take care of patients, and we called it the Patient Compensation Fund. We didn't have exchange plans at that point. Now we do. Let's think about that. We need to look at whether or not we should allow people to pick their jurisdiction and pick the most sympathetic one. I have a clinic in Gallup for the last 18 years. I didn't go to Gallup, New Mexico, because I thought I would make a lot of money taking care of folks on the res. But I love that clinic. And when I saw that hospital have a punitive damages award of $56 million, I thought, one trial attorney made a lot of money. One patient is now very wealthy. I know that surgeon that was involved, and I know what happened. And that patient is now exceedingly wealthy, and 120,000 people who live in and around the reservation may lose access to the only hospital that they can see. And if that goes down, my practice goes down with it, because I can't do what I do without the whole rest of the medical community, including the hospital, doing what they do. So people who are in a different jurisdiction don't really care if you lose healthcare services in Gallup. They're not living there. We care. We want to see that happen. We need to get rid of this stacking of verdicts where everyone whose name is in the chart, it's another cap. But most, we need to have reasonable caps put in on pain and suffering damages. We need to get rid of punitive damages. We need to look for innovative and creative ways to take care of patients who are injured, whether or not they go through the medical malpractice system. And we need to make sure that no patient is forced to live under the bridge, destitute because of something that happens because of the care that we give. We're trying our best to do the right thing. We need the help of the legislature to help us continue to stay here in New Mexico. Thank you.
Thank you, Doctor. Dr. Ritchie?
Thank you very much, Mr. Chair and Senators. Thank you for listening to us. Thank you for inviting us to things like this. It started, the summit with the governor was great, and I am glad that we are seeing the ball continuing to roll. So we really appreciate it. I'm an orthopedic surgeon with New Mexico Orthopedics. I'm in our main office in Winrock, but I'm also in Rio Rancho at our office there across from Rust. I've been here, well, I came in the Air Force, and after being born at Holloman, don't want that place to go away. And I stayed. And that's because we love it here. I did keep my Texas license, though, for all this time, because you can see that even 30 years ago, you could start seeing some of the weak points here. But, you know, I've already lost 2 partners in the last 3 months. It is hitting everyone, this crisis that we have again. Now, one little point we haven't heard before, why malpractice and the cost of malpractice makes it different. We've heard a lot of different other avenues how it affects physicians. But, you know, in the system that we get paid by the government now, okay, through CMS, the RBRVS system, the resource-based relative value system, okay, it has 3 primary components. There's the work, the practice expense, and the medical liability cost. And there's only those 3 categories. So the government thinks that the cost of medical liability is that important, okay? Now, they're not equally weighted, and the medical liability is lesser weighted than the others, but it's that important. There's also a geographic cost factor, and that's how we heard mentioned earlier that even though you pay in the same to Medicare for your Medicare care later after you finish working or you reach 65, the physicians don't get back the same amount of money. You pay in the same amount of money they do in New York and California, but physicians here get a much lower rate than the physicians in those other places because of the geographic and the cost of work. Now, the medical liability expense, we're like, okay, well, our costs are going up, so they'll increase our pay. They only look at that every 3 or 4 years. So, you know, it's not going to help us. So that, you know, that's part of why this is such a big deal. Now, as you've heard already, there are many ways to look at this, and there are many things that can be changed. Now, I'm also the chair of the New Mexico Patient Compensation Fund Advisory Board, not of the fund. The fiduciary of the fund is the superintendent of insurance, and she makes the decisions, but we advise her. Our board has basically 5 people that are medical with the Hospital Association, Medical Association, and the nurses. And then there are 4 people, there's 2 patient representatives and 2 trial attorneys. So there's equal representation there. We advise on the funding. And we've been really focusing on the funding going forward, or to see that when the hospitals come out from under the cap, that they are made whole, that the fund is made whole. Well, that's fine, except that's only at that date. After that, medical liability cases take 3 years to start maturing. And then the payments, the settlements, even the trial itself can be years and years after that. But that money for the PCF portion would come out then, not back when the hospitals came out and stopped paying into the fund. So that's very worrisome for the future of the fund. However, the fund does pay future medical, and that has been changed with our new superintendent of insurance, that she has said that she will review every case, and the lump sum payments are going to go away unless extenuating circumstances, whereas in the past they weren't. So those did drain the fund. Dr. McEnany is absolutely correct. There were some egregious incidents and not so great management of the fund in the past. That's why the board's there. And HB 75 actually put in the board too, so it was a little bit good came out of that. So we are meeting tomorrow, actually, to look at the funding for next year. And the PCF, the physician part is whole. We are even. The increase for next year is still going to be over 10%. And that is because of what's happening in the courts. The amount, the number of cases, and the amounts that are being awarded. And so that is not going away unless we fix this. And a big part of it, I've got to say again, everyone has said it so far, punitive damages. the lowest level of evidence that there can be is what's used here, and no other state is using this level and seeing this many awards and this many attempts to get punitive damages. 90% of cases. I mean, who thinks that 90% of doctors are out to harm patients? So, that everyone said a lot more, so I'll stop there in the interest of time.
Thank you, Dr. Ritchie. And yeah, we are a little over time, but I just felt like it was important to hear from you, the doctors, on what's going on. I've heard that almost every suit, whether there's any negligence or not, they're filing for punitive damages. Is that correct?
Yes, Mr. Chair, absolutely. 90% is what our insurance companies are telling us.
So, thank you. I think that's an important thing. Did anyone have any questions? Pat, go ahead.
I've got one question. I understand through many of the budget discussions that I've been through lately that they're having trouble finding administrators for that fund. And one reason they're having trouble, I heard, was that there's no qualified immunity to the administrators. Have you heard anything about that?
Mr. Chair, Senator Woods, I have not heard. We are looking for a new administrator, but that was scheduled, or I mean, we have the statutory admonition we have to search or make sure that we have, opportunity for the fund manager to be changed if necessary. It has to be reviewed. I have not heard that we're having trouble finding one because of that. However, I can certainly find that out tomorrow.
Please do find that out, because where I came about it was when the Office of the State of the Insurance, OSI, wanted to have more FTEs, more positions to handle this. If they had to handle it themselves, they wanted to employ some more people. And I think it was like 10 or 15 people they needed to do that. And that, that's a cost to the state. So that's why it came into my preview. But I heard that essentially there was 3 administrators that were qualified to administer this within the state, and they have got nobody wanted to do it. So I don't know. Please get back to us on that if you would.
Yes, sir.
Thank you. Thank you.
Senator Thornton?
Thank you, Mr. Chair. Just one quick question for Dr. McEnany. You had mentioned the possibility of using health courts. Could you expand upon that? What did you mean by that, and how would that help? How could that be one possible way of helping this particular situation?
So, Mr. Chair, Senators, one of the issues that happens very frequently in medical malpractice is that you have an injured person who is a very sympathetic soul. And we feel that same sympathy for anyone who is damaged and not well or harmed in any way. And so do juries. But, for example, when the case happened in Gallup, it was from doing a herniorrhaphy and nicking the bowel, which will happen about 3% of the time. And it's a terrible thing to have happen because it causes local infection, et cetera. So the problem is that they look at this person who has been injured and they feel a lot of sympathy for him, and the way to make up sympathy is to give a lot of money. But when something happens despite the best intention of the surgeon, the odds are that you will have something happen a certain percentage of the time. Those facts fly out of the window. So the idea of a health court would be that someone who is very well versed in both the law and has access to bona fide medical experts in that field, so that it can't be just someone who makes their living running around being a medical expert witness, that you can determine some of the issues based on the science of the odds of something happening rather than just assuming it is med mal. For example, that's happened a lot in
in obstetrics, where cerebral palsy used to get huge awards, but it has nothing to do with what happens in the last hour of the pregnancy during the delivery. So injecting some science and some data-based processes into a system would be most easily done by a health court. It's an out-of-the-box idea, but it is time for our legislature to look at some out-of-the-box ideas to try to fix this crisis while some of us are still here.
Thank you for that. That's all I wanted. Thank you, Mr. Chair.
Senator Block, real quick.
Yep, thank you, Mr. Chair. Well, I would disagree with you. I don't think we need out-of-the-box ideas. I think we just need common sense, and it's out there. But I understand what you're saying. Real quick, first of all, thank you all for being in New Mexico and practicing. That's huge, so appreciate that, and especially you, Dr. V. Hill, with all your family up there in northern New Mexico. So tell me real quick, doctor, I feel like spies like us. Tell me real quick, have you heard of any companies saying, you know what, I'm not going to cover you as a physician in the state of New Mexico. It's a money loser for us. I'm not going to do it. Have you heard of that happening?
Mr. Chair, Senator, the short answer is yes. And
Wait a minute, so you have heard of insurance companies saying, we're not going to cover you as a medical provider?
I have, and I've seen the rejection letters. So not in my practice at this point, because we pulled out and went separately.
So real quick, because I'm sorry to interrupt you, Doc, but real quick, because we have just limited amount of time, did they do that because of the medical malpractice laws in the state of New Mexico? Yes or no?
Yes.
Thank you. I've never heard that before. I don't know if you guys have heard that before, that they said, you know what? It's too much of a risk for us. We're not going to cover you. So I hope the public knows that insurance companies are staying away from New Mexico, and that's just very bad news. So, Doctor, sorry to cut you off, but we're out of time, so we'll talk some more. Thank you, Mr. Chair.
Thank you to all three of you. I've enjoyed working with all three of you in the last few years and getting to know all three of you, and thank you for serving New Mexico and the patients here. We're going to move on to the hospitals. We have Julia Renton, the New Mexico Hospital Association, Kay Green, Roosevelt County, and Darren Schaefer. Again, out of an interest of time, I'm not going to read your bios. You guys have strong, great bios. We appreciate you being here and everything that we've been talking about. I think the main thing is, you know, what are the things that we can do as a legislature to help fix patient access to care in New Mexico?
You want to go first or me?
Dr. Schaefer, you want to start us off? Go across.
Sure, happy to. And Chair and Senators, appreciate you taking the time. To Senator Tobias, I'm really sorry that you're going through what you're going through. It's a frustrating and incredibly scary experience. Senator Block, at Presbyterian, we're working closely with Kirtland Air Force Base, trying to provide services and figure out how best we're able to do that. And it's important to us. Just a little bit on my background. So emergency medicine is my training, and born and raised here, born at Presbyterian Hospital, so still there. And so I know that we have an intense focus on ensuring patients across the state have access to safe, high-quality care. In today's New Mexico malpractice environment, it puts all that at risk from an access. And it's really three ways that I think about it. There's the direct costs, there's the recruitment and retention of top talent, and then there's workplace morale. New Mexico's uncapped punitive damages, we've talked a lot about that. I just want to share a stat from Presbyterian. So over the last 5 years, our premiums have gone up a total of 225%. Additionally, the retention costs, which is like our deductible, if you will, have increased by 200%. and it's reaching as high as $20 million per claim. So if you can imagine, we're a nonprofit healthcare system trying to survive with that. And at the end of the day, it isn't just about hospital budgets or lawsuits. It's about whether we have New Mexicans that are able to get the care that they need to get. And so for us, we have Presbyterians, 9 nonprofit hospitals across the state. And so that impact is not abstract. The medical malpractice environment affects our ability to recruit and retain top talent efficiently. We had Dr. Vigil up here with OBGYN services, and we think about some of the rural services, the risk of lawsuit, and it's high risk in less litigious environments. And so it takes us a lot longer to hire, longer for expectant mothers to receive the care that they need. In some cases, the lack of options forces them to travel long distances for prenatal care and deliveries. And these are the trade-offs that the communities in New Mexico are increasingly at risk of facing when malpractice lawsuits and related costs spiral. Second, New Mexico medical malpractice environment affects the ability of hospitals and clinics across the state to recruit and retain top talent. And as we attempt to attract physicians, the high rate of lawsuits and potential financial damages influence their decisions. And when you look at the national healthcare workforce shortages, doctors are going to compare us with our neighboring states.
Dr. Schaefer, could you bring your mic closer? Sorry.
Apologies.
No problem.
So when we look at the shortages that are going on throughout the state, we also look at what's going on in the United States. And doctors often compare us to neighboring states to decide if they're going to locate here or if they're going to locate elsewhere. It's true for physicians in our medical group, and we have about 1,350 physicians and advanced practice practitioners in our medical group. And then the third is that human impact that was talked about a little bit with Dr. Vigil, and it was really about the idea that when physicians and nurses are caught in lengthy malpractice cases that often endure years of stress, and certainly, and so much so that we actually created a program within Presbyterian called litigation support. And it's because of the trauma that the physicians go through when they're dealing with everything you deal with in a lawsuit. And that also contributes to burnout. And in some cases, it leaves providers to leave the state. I'm aware of a few of my friends who have done that, and one that has left medicine altogether as a result of that. And it also does increase the cost throughout the state because people do practice defensive medicine. They want to make sure they're not missing anything. They don't want anyone to have anything that they can say that they might have not done correctly. And so they're ordering a lot more tests, a lot more expensive tests from that perspective. So we've taken a lot of steps as we look at how we try and support our workforce at Presbyterian, and we're fortunate we have some of the resources to be able to do that. So I think focusing on balanced steps, that word again, to address these challenges like setting up reasonable caps on punitive damages. They still preserve patient safety and accountability. These reforms help New Mexico with stabilizing our healthcare workforce. They protect patient access, ensure our communities continue to receive the care they need, and we're ready to work alongside the legislature. And the last thing I'll say is that when we spoke earlier about whether there's an impact from the medical malpractice, that we have insurance companies that are saying we're not going to come and cover you. We have physician groups, so we have some close partners that we work with who have not been able to find other national groups to come in because of the malpractice. And that's a big concern. So it's not just on the insurance side, it's also medical groups that will come in where we have a shortage and they're saying we're not going to come in there for that reason. Thank you.
Thank you. Ms. Green?
Thank you. And first I wanted to say also to Senator Tobias, and my heart goes out to you. I don't know how you're functioning and sitting up right there. Thank you to Senator Woods, who invited me to this panel, and Mr. Chair, and to all of you for listening to us. I lead a small community-owned hospital in Roosevelt County, Portales. We are an independent hospital, so the buck pretty much stops with me and my board. And I wanted to give you the perspective that we have from a rural hospital setting and what I've actually experienced firsthand on the ground. Senator Block, to your point, since the legislation was passed in 2021, every year when I would go out for malpractice insurance, I would typically get 6, 8, 10 quotes from different carriers. Over each of the last 3 years, my insurance broker has gone to over 20 carriers for a quote. 18 of them have refused to quote me. I've only gotten quotes from 2 insurance carriers over the past 3 years. The rest have pulled out of New Mexico. And I'll give you some hard numbers. In 2020, and I've got 19 providers in my hospital and my practice. I've got attached clinics. In 2020, my annual premium was $319,000 with a $25,000 deductible. The year I went out for insurance after the legislation was passed in 2021, my premium went up to $612,000. And just to be able to afford that, I had to increase my deductible to $50,000. It stayed in the $620,000 to $650,000 range until this year. I went out for a quote in July. I got 2 quotes, $1.42 million and over $1.6 million. And my deductible is now $100,000 just to afford that premium. So to set the stage, a lot of folks think hospitals and doctors have deep pockets, and we do not, especially small rural hospitals. We are struggling. And I do want to thank you all for passing the Healthcare Delivery and Access Act. Up until that point, which increased our Medicaid state-directed payments, it was hit or miss every year where we were going to end in the black or in the red. So that's how slim our margins are at a small community hospital. So the hit on malpractice premiums has been huge for us. But I have to say, that's not the most important aspect of it. It's the inability to recruit physicians. With the Healthcare Delivery and Access Act, for the first time at my hospital, we were actually looking to expand specialty care because most folks in Roosevelt County actually travel to Lubbock or Amarillo, Texas for specialty care. And we don't feel that's right for the people who live in Roosevelt County. And we also want to support Cannon Air Force Base. And we've stood up a few programs to try to bring families into Cannon from the medical perspective. So I'll give you a couple of real life stories. We decided to expand into orthopedic surgery and to urology, not full-time, but part-time. So I contracted with a company in January. We had an orthopedic surgeon from El Paso who wanted to start a part-time rural practice with us. He came, looked us over, loved our little hospital and clinics, our staff, and 2 months later, going through the credentialing process, he stopped responding. And so when we had conversations, come to find out, he had gone back to El Paso and shared with his colleagues his plan to start a rural practice in New Mexico. And they all said, stay away from New Mexico. And he pulled out. We had the same thing happen with the urologist. I've had a cardiologist who loved us, who wanted to come and join our little hospital. Same thing happened. He was from Colorado. Pulled out because of the brutal venue New Mexico is, and that's a quote, for litigation. It's just too risky for doctors to want to come to this state anymore. And so I'm doing everything I can to expand access to care in a rural setting, and yet I feel like my hands are tied behind my back because of the medical malpractice situation. I actually had a medical assistant who applied to UNM. He actually applied 3 times. He got into med school on his 3rd time. So he is actually in school for the 1st semester now. He wants to be an orthopedic surgeon. And I said, Austin, are we going to get you back one day? Because we try to get people back, and we're usually pretty successful when they go off to school. And he said, Kay, I would love to come back and practice at RGH, but it is too risky. I will most likely go to Texas. He was born in Portales, raised in Portales. His dad is an academician at Eastern New Mexico University, and yet he probably will not come back to New Mexico if this situation is not resolved. So that is a picture from a small rural setting, and I'd be happy to entertain any questions.
Thank you. Julia?
Good afternoon, Senators. Thank you for the invitation to be here today. I'm pleased to be seated next to these two great representations of hospital leaders in New Mexico. My name is Julia Ritten, and I'm the Senior Director of Government Affairs for the New Mexico Hospital Association, which is the state's nonpartisan trade organization for hospitals. I'd like to take a moment to speak about the members of our association. We're proud to have 48 hospitals in our membership, covering all types and locations of hospitals that you can think of: urban, rural, big, small, private, public, academic, you name it, and they're in our membership. As you know, hospitals are woven into the most meaningful moments of our lives, welcoming new life, providing healing in times of crisis, and offering comfort in life's final chapter. In 2023, more than 18,000 babies were born in New Mexico hospitals, and nearly 1 million patients turned to our hospitals' emergency departments for life-saving care. These numbers are more than statistics. They reflect the essential role hospitals play in every community. To protect that role, we must ensure their long-term sustainability. Because of the size and diversity of our members, we have the unique position of representing hospitals whose interaction with the Medical Malpractice Act, which, as you know, was amended in 2021, varies. Some of our hospitals are covered by the Tort Claims Act, like Kay's Hospital, which covers governmental entities. Some of our hospitals are covered by the Medical Malpractice Act because they participate in the Patient's Compensation Fund, such as Presbyterian. And other hospitals are not covered by either and do not participate in the Patient's Compensation Fund. However, almost every hospital has been impacted by the changes in 2021. It's important for me to share the principles that guide us and our members when we talk about medical malpractice, because it can be easy to forget them given the urgency of the situation before us. First, while instances of malpractice across healthcare providers is limited and rare, medical malpractice protections for patients who have experienced acts of malpractice are incredibly important, and we do not support in any way trying to remove those protections. Second, the Patient's Compensation Fund is a significant resource that should continue being available to patients regardless of where the malpractice occurred, and this will end at the end of next year as hospitals will be removed from the PCF. Third, the act must be changed to bring balance, as you all have talked about, back to the system while continuing to protect patients who have been harmed. As you've heard, punitive damages have grown so large that there is a real risk of smaller hospitals not being able to meet that obligation. And additionally, changes to the act should target provisions of the law that have led to increasing premiums and the departure of insurance companies writing malpractice policies in the state. It is possible to keep the needs of patients who have experienced lifelong health consequences due to medical malpractice at the core of the act, while ensuring that it does not dissuade providers from serving those in our state. We know the reality of how things are today. You've heard it all day long. The changes in House Bill 75 resulted in real, tangible, unintended consequences that have negatively impacted New Mexico's hospitals, healthcare systems, and patients' ability to access timely care. I just want to be really explicit. These unintended consequences include limited insurers writing policies in New Mexico, an exodus of physicians from the state, and a move to employed, meaning employed by the hospital or a clinic rather than independent practice, despite all of the great investments that you have made in providers through Medicaid and loan forgiveness. We have an access to care crisis that's threatening the sustainability of services in rural areas. And as Kay mentioned, there's been significant increases in malpractice premiums. So today I want to thank Secretary de Blasio and the governor for hearing our call at the summit, which was a request to convene a work group to address this issue. We alone as hospitals, physicians alone, insurers alone, attorneys alone can't propose changes. It has to be a collaborative effort. And so it's really great to hear that that looks like the steps that will be taken after the special session. And I'm also happy to stand for questions along with my colleagues.
Mr. Chair, if I could add one more comment. I believe you heard from our colleague from DOD earlier that New Mexico has lost 248 physicians over the past 5 years. I just want to put that in context. That's an 8.1% decline in physicians, and we are the only state in the country that saw a decline in physicians over that same time period.
And on top of that, we were already short. So we've lost 248 from the shortage we already had. That's what I understood from that testimony. So thank you. Pat?
Just quickly, Kay, thank you for driving so far. You know, me and you are used to traveling long miles.
Yes.
But thank you for coming today. We've tried several different bills trying to keep the small hospitals viable. And I think in the special, we're going to talk a little more about that. So I worry a lot about rural health care. We are just in a position, Presbyterian has the hospital at Tucumcari. And without you there, we could never survive that at all. And the Clayton Hospital I've already talked about. You know, Senator Block was talking about having 2 hospitals in his district. Well, I've got 3 and damn near 4 in my district. And they're all pretty small hospitals, Clovis being the biggest hospital. And it has the Cannon Air Force Base there in Clovis, and that's one reason we're able to maintain that. You know, those young guys, they get hurt a lot, especially with what these guys do, and they need the health care. But when we start talking about losing doctors and the amount of staff it takes, it's just unbelievable how much staff it takes to provide one service, OGBYN service in Las Vegas. It was 10 nurses it would take and 2 doctors to keep that service in there. And that was just the start of a tumbling of loss. But out of Las Vegas, those guys are driving, those young ladies are driving 130 miles for service now. At one time, those old country doctors did everything. That time is long past. And we have to figure this deal out. We've got to figure out how we can keep healthcare services in Raton, in Clayton, in all the northern New Mexico places that we need services. Those are critical areas in my district to keep services in. But thank you, Mr. Chairman, and thank you, Kay, again.
Thank you, Pat. I appreciate
Not that
it.
Julian and Dr. Schaefer, I appreciate y'all coming too, but thank you very much.
Thank you, Pat. We are really out of time. So okay. Nicole, go ahead.
Thank you, Mr. Chair. I'll be brief. Thank all 3 of you. Really, thank you for what you do and for taking a stand and being here today. One of the things that I've heard time and time again from my colleagues on the other side of the aisle that are dead set against helping us make changes and forward movement in medicine in New Mexico is that the reason why we have this exodus or perceived exodus of doctors is because the numbers hadn't been updated in maybe a decade or more, and they're denying that we're losing doctors for any other reason than just normal attrition. Can you speak to that, please?
Yeah, happy to. So we, in the medical group, we lose about 8% per year. So we have 1,350. So if you start looking at the numbers in that alone, and we were working hard on recruitment, we're able to be successful at times with recruitment and times we're not. There's specialists that we're looking to hire into and we can't obtain that. We have started doing, trying to do some actual virtual medicine. And so that's telemedicine, and we're trying to work through that as a way of having people who don't want to come here for various reasons can still live out of state but take care of New Mexicans as we're trying to bridge the gap that's growing.
I'd like to add, it's not just that we're losing physicians, we're also losing business partners. And I'll give you a real example. 60 days ago, The group that reads all of my medical images, so those are CTs, MRIs, X-rays, ultrasounds, mammograms, the group was out of Lubbock, and they had to recruit a number of new radiologists into their practice. And those new radiologists did not want to get licensed in New Mexico because they felt the risk was too great. So that company, Coaxian Radiology, informed me in writing out of the blue that they were terminating their contract with my hospital in 60 days. So we have scrambled to find another, and they did this with another New Mexico hospital too, for the same reason. So we have scrambled to find a new radiology group to read our images so our patients don't suffer.
Thank you for that. And so you said you're losing 8% a year. Is there an average around the country of what a hospital system would expect to lose attrition-wise in doctors per year?
You know, I think it varies depending on some of the nuances, whether it's academic, whether it's a multi-specialty group and so forth. But for large multi-specialty groups, average is probably around 7 to 7.5%.
Thank you for that. Thank you, Mr. Chair.
Thank you. We really appreciate y'all. And Kay, I had one simple but really difficult question.
Sure.
What would happen if you went away to the people in your area?
I think the community ultimately would go away. I think this was touched on earlier. There are 3 vital components to any healthy community. It's education, it's healthcare, and it's safety. And you take one of those away, and I think our community would dwindle and eventually not be there.
Thank you. Jay?
Thank you, Mr. Chair. Real quick, 2 very quick things, and I don't really need an answer, Kay, from you. But are you sure you're telling the truth out of 18 out of 20 insurance companies?
Yeah.
You're not lying to us?
I've got written documentation. I am happy to provide
Okay,
you.
good. Just want to get that on record again. You're not lying.
Yes, I am not lying.
All right, I'm going to throw one question to my good friend Senator Woods. The big, beautiful bill that was passed in regards to $50 billion for rural hospitals that unfortunately no Democrats voted for. Kay, out there in Roosevelt County, how does that affect you real quick?
It's huge. We're waiting for the Hospital Association to have enough information to start modeling the impact on every New Mexico hospital. But what I can tell you is it could potentially be huge. We've just now been shored up through the Healthcare Delivery and Access Act, and to have that pulled out from under us could be devastating. The $50 billion at this point, we know that it will be split and the state will administer those funds. There's no guarantee that my hospital will get a dime of that. We simply don't know because there are no criteria that specify it to that level.
Okay, thank you, Mr. Chair. Thank you, Kay. Are you sure you're telling the truth?
Yes, sir.
All right, thank you.
Thank you, all of you. And our last panel, we really want to focus on getting into solutions. So I think we've heard the problems, we've heard the issues, and so we just want to ask this last panel to really focus on what are some solutions that we can bring to the legislative session, probably in the 30 days. I'm not sure what's going to happen in 2 days from now, except that I'm going to have a granddaughter in about 2 days from now, so that's an exciting thing for me. But we have with us today Carrie Bruner, one of my favorite lobbyists, who lobbies for the Medical Association Society, and Fred Nathan with Think New Mexico. Fred, you did a great report on hospitals, which is why we asked you to be here on this very subject. And so we just want to focus on, give us some solutions, give us some answers. We've listened to the problems, and I think that you both have some good solutions for us. Thank you.
How about now? Great. Okay, well, maybe I should just start with what is Think New Mexico, because I'm guessing some people that are watching or in the audience have never heard of us. So we are a results-oriented think tank, and we're a little bit different than most think tanks that are generally way over on the left or way over on the right. We just believe in a state like New Mexico that's 49th or 50th in too many of these national rankings, that maybe the focus should be on solutions rather than political ideology. So consistent with that, we have a board of directors made up of Democrats, Republicans, and independents. I'm an independent. You would know many of these people. For example, we have former Governor Gary Carruthers, a Republican. We have Paul Bardicke, who's a Democrat, former Attorney General. And it's a good group of statesmen and stateswomen, people like Clara Apodaca, former First Lady, Jackie Baca from CEO of Bueno Foods in Albuquerque, Nota Begay, the golfer, but also a wonderful philanthropist and supporter of child nutrition. Anyway, this always sounds like terrible name dropping, but such a small state, it's the board member that I don't mention who turns out to have a brother or sister in the audience, and then I hear about it. So anyway, it's a good group of statesmen and stateswomen who have no other agenda than to try to lift the state up in these national rankings. And I just want to say, and the other way that we're different is that when we come up with recommendations, we don't just cross our collective fingers and hope something good happens. We convert our ideas into legislation, and then we identify sponsors from both parties and both chambers and get after it. So anyway, I wanted to commend you as a bipartisan think tank. Really pleased that you were so inclusive, and also for your leadership in bringing everyone together. We're all in this together, and it's going to take all of us to fix it. So let's start at 30,000 feet. What should a properly functioning medical malpractice system look like? Well, first of all, at a foundational level, we want to make sure that all patients who have been harmed by medical malpractice are made whole. That's not happening right now, as I'll talk about later. We also need lawyers to protect their interests. I'm not against lawyers. Full disclosure, I am one. I'm actually a recovering attorney, fourth generation. Worked with trial lawyers once upon a time when I worked at the Attorney General's office when we brought the lawsuit against the tobacco industry that recovered $1.25 billion. So we need lawyers involved in this system as well. But we need to do all this in a much more balanced way so that we're not driving doctors into early retirement, like my friend Debbie Vigil, who was my wife and my daughter's OBGYNs until the 2021 law changes, and driving other doctors out of the state, like Andy Metzger, who I'll mention later. So obviously we shouldn't be bankrupting hospitals either. Our medical malpractice system, as you know, is currently broken. It doesn't serve the interests of patients. So let me talk about one part of the solution, which is to help those patients. And Senator Woods carried a bill along with Senator Hickey on this in the last session. And it tried to do three things. First, cap attorney's fees. We're a state that doesn't cap attorney's fees. There's no statutory cap on medical malpractice. But if you look at other progressive states like New York, California, Massachusetts, they all cap attorney's fees. Why do they do this? They do it because it's a zero-sum game. The more that goes to the attorney, the less that's available for patients to make them whole, which again is at a foundational level what we should be trying to do. So in Senator Woods' bill, we had a provision that we borrowed from California. California has actually a very sensible way of paying attorneys. 25% if the case is settled, 33 1/3 if it goes to trial, because there's more work involved in getting a case to trial. So that was the first part of the bill. The second part of the bill had to do with the Patients' Compensation Fund. And as you probably know, this is a fund that goes back about a half century. And it's designed to address those cases where there's a lingering issue and you're going to have medical costs the rest of your life. It used to be, until 2021, when it was changed by the legislature, a pay-as-you-go system. So every month you, as a patient, would send your medical bills to the Patients' Compensation Fund and get reimbursed dollar for dollar. That seemed to work fine. I think in some cases the trial lawyers were very opposed to this system. I think it's awkward if you have to go to your patient every month and say, well, that $412 payment, 35% or 33% or 40% is mine. So they said, let's go to a lump sum payment up front. That involves actuaries that we didn't have before. But ultimately, what it does is it puts all the risk on the patient. Let me explain. So let's say I'm the patient, and let's say I go to the patient's compensation fund. First, the actuary looks at me and says, well, Fred's looking a little long in the tooth. We think he's got about 5 years to go. And he's got $100,000 of damages that he'll need for those years, $500,000. First, what goes to the lawyer comes right off the top. But let's say I live 10 years instead of 5 or 15 years. Then I will run out of money to pay my expenses. On the other hand, let's say I die in 2 years. Then the taxpayers have overpaid and there's less money available for the next patient in line. So we proposed in Senator Wood's bill to just go back to the old system, which was pay as you go. It seemed to work fine, and we should go back to that. And then, of course, the third issue is punitive damages. Many speakers have already talked about this. In Senator Woods' bill, we came up with, I think, a fairly novel approach, which is to recognize that in the case of punitive damages, so there's 2 types of damages that a medical malpractice victim might be entitled to. One is compensatory damages. And secondly, in very rare cases, when there's been gross misconduct, they're entitled to punitive damages, which is designed not to compensate, but to deter bad behavior. And so we said, well, instead of showering more money on the trial attorneys, why don't we take 75% of punitive damages and put it into a patient safety fund to help some of these rural hospitals that are understaffed or hospitals that need more training. So that bill was introduced on the 8th day of the session. It didn't get heard until the 53rd day. So that was 45 days. But I'm happy to report in the intervening time, legislators heard about this bill, and it had the most co-sponsors of any bill last session. You know, it's a myth that, well, medical malpractice, we can't touch that. We can never get that done. Well, we had 24 co-sponsors, 12 Democrats, 12 Republicans, including several of you. The other, so that's on compensating patients and how patients are not very well served by the system. Also, many have talked already about that the system doesn't really serve the interests of doctors very well either. It's been mentioned about the loss of 248 doctors. I'm glad that was put into perspective, 8.1% of our physician workforce. What wasn't mentioned is nationally, and this goes to your question, Senator Tobiasen, nationally during that same period, the number of doctors went up by 44,000. And so a lot of people say on the other side, well, it's bad everywhere. It's especially bad here. It's the most dire in New Mexico. That's the point that needs to be made with regard to that. So why is it that we're losing these doctors? And in our research, and we spent 2 years producing this report, and we talked to a lot of doctors, and there are a couple of reasons that don't have to do with medical malpractice, and I'll just touch on them very briefly. We're one of only 2 states that taxes medical services. The other state is Hawaii. They cap it at 4.7%. In New Mexico, it's the full gross receipts tax. And when I talk to doctors, many of them explain it's not just 7 or 8%. You also have to hire people to collect those taxes, to deal with tax and revenue, and to fill out all the paperwork. So we're really talking about 10%. Another reason that's been given, where the legislature's done a lot of good work actually, is our very low Medicaid reimbursement rates. And I know the legislature has been moving heaven and earth to bring that up. And kudos to those of you that sponsored Senate Bill 88, which created the first permanent fund for healthcare in New Mexico. And you seeded it with $511 million over the next 3 years. That was really excellent, because when it reaches $2 billion and we start taking a 5% draw, which would be $100 million, we're going to get that matched 3 to 1. Now you'll have $400 million annually that can be used to raise those rates to a level where doctors won't still be telling us, I'm losing money every time I treat a Medicaid patient because the Medicaid reimbursement rates are so low. But the number one reason why doctors retire early or leave the state, by far and away, is medical malpractice. Our medical premiums are about double our neighboring states. On Senator Woods' bill, we had a doctor from Arizona, Andy Metzger, born and raised in Albuquerque, started practicing here in Albuquerque, neurosurgeon. He left because of our medical malpractice rates, and he testified to the legislature that his current rate in Arizona is 1/5 of what he used to pay in Albuquerque. So when I say it's double, that's on average. It depends if you're a specialist or primary care physician, but it's higher than it needs to be. And that's, I think, a lot because we have the lowest standard for proving punitive damages in the country. And so,
Fred, real quick, give us just some real quick solutions, because I think Wayne needs us out of here at a certain time. Okay.
Okay, well, the three that I mentioned, we should cap attorney's fees. We should do something about the patient's compensation to go back to the old system, pay as you go. We should raise the standard for punitive damages. I note that Colorado, our neighbor to the north, uses clear and beyond a reasonable doubt, which is like 99%. That's one approach. And we should cap punitive damages. So those would be my reasons or my suggestions for a comprehensive bill.
Now, I would ask you, but I don't want to put you on the spot, but how do we get the other side? No, sorry. Carrie?
You're not going to ask me that question, right? Thank you, Mr. Chairman, for the opportunity to speak to you all today. I'm the lobbyist for the New Mexico Medical Society. We have been deep in the trenches on this fight since 2021. We really are very pleased that you all have called together this group of people to talk about this problem. We are very, very pleased that the governor has decided to really lean into this issue by calling her summit. We're so happy to see Secretary de Blasio here today and think that this is a really good sign that the tide is turning and that hopefully we will be able to put a better foot forward in Santa Fe in the 2026 session. I think that what I would like to do just primarily to kind of sum up the day and everything that I've heard is say we've done a really good job at busting some myths here. There's a lot of noise happening in this debate in Santa Fe and in our communities, and I think we need to be really clear about what is noise versus what is real. So the first thing is we always hear private equity is the problem. We have the largest concentration of private equity-owned hospitals, and that's why our medical malpractice situation is bad. There are private equity-owned hospitals all over the country, and medical malpractice premiums are lower across the country. The instances of medical malpractice lawsuits are less in every other state except for Pennsylvania, even though every other state in the union has private equity-owned hospitals. Those hospitals have to meet the same credentialing requirements that anybody else has to do. And while I think we can have a policy conversation about private equity, I don't think that there is a causal link between private equity and medical malpractice in this state. Because even our community-owned hospitals, like you heard about today from Roosevelt, San Juan Regional Medical Center, Sierra Vista, Cibola General, they are hospitals that are experiencing the same problems with medical malpractice as any of the others. And I think those stories are the stories that we need to listen to cut through the noise. The next myth that I think we hear about all the time is the insurers are just greedy, right? They just want to make money. First of all, you heard today that New Mexico insurers have a 110% loss ratio, which means for every dollar they collect, they are spending 110. We've seen studies where that loss ratio is all the way up to 183%. So there is not a marketplace that works right now for insurance companies. And as a result, the market competition is becoming less and less. Why would those companies want to do business here? But let's say they're right. Let's say insurers are just greedy. If that were true and that were the problem, every single physician in the entire country would be paying what we pay in New Mexico. That would be the best way for the insurers to turn a profit. And that's not happening. We also have heard that medical malpractice is just about the cost of premiums. If we just give relief to the clinicians, everything will be fine. Our physicians have never asked for a handout. There have been times where the state legislature has stepped in to create solvency in the PCF, which we are very, very grateful for. But all we have asked for is a fair deal, a system of balance. But it's not just about the costs. You heard a lot today about the moral injury that our physicians are facing every single time a medical malpractice suit is levied against them. Every single time a suit is settled or there's a judgment made, that physician has to report to a national database what happened. And that report follows them and their license for their entire career. Every time they apply for a new job, every time they try to get a license in a new state, every time they get to be credentialed at a hospital to perform services there, they look at that national database. Why would our young residents who are coming out of medical school choose to practice in an environment where the chance that they will have a medical malpractice suit levied against them is so high, and then that suit will follow them for the rest of their career? The other thing we hear a lot is punitive damages are covered by insurance. So why is this a big deal? They're not, period. That's just the truth. And punitive damages are meant to be for the worst of the worst, right? A doctor was intentionally hurting someone. We have heard that from our insurers that they're being levied on 90 to 95% of all cases. Can you imagine having all of your personal assets, your retirement, your child's college education, your house on the line every single time a malpractice suit is levied against you in a state where we have the most malpractice lawsuits other than Pennsylvania? The fear that our physicians feel leaves them to ask their insurer to just settle. I don't want to lose my home, please just settle. And that drives up the cost for everybody. We've also heard indications that patients aren't safe here. We summarily reject this statement. Our hospitals meet the same accreditation as others across the country. Our physicians meet the same standards from their boards of specialties that physicians meet all across our neighboring states. But our patients are sicker. Our citizens, because they cannot get access to care in a timely manner, show up in our clinical offices in a worse position than they would have been if they had been seen earlier. And this creates a cycle where that patient is not getting all of the care that they deserved in the time that they deserved. When we get to them, we take care of them to the best of our ability, and it is world-class healthcare. But it is not just for the rest of our citizens to have to wait because of the system we've created. We can do a lot of other things in New Mexico. We can fix GRT, we can increase our loan repayment, we can give tons of tax credits, but there is a national shortage. And all of our states our competing states are doing the same thing, right? They're increasing loan repayment, they're doing all of these things to recruit the best of the best. So we need to keep up with that. We need to do all of those things. But unless we fix medical malpractice, fixing all of those other things will not move the needle enough for us to take care of our healthcare shortage. The final thing that I will say is we do hear a lot of times, there isn't really a healthcare crisis. Every single person in this room's lived reality is starkly opposite to that statement. We have all had family members, we ourselves have needed to get in to see physicians, in to see our other clinicians. There are tens of thousands of patient-clinician interactions that happen in our state every single day. And a fraction of them have an adverse outcome. And a fraction of that fraction of that fraction is actually medical malpractice. Creating a system that is so leaned towards that small, less than 1% average is not a system that is just for everyone else in our state. So we know that there's lots of ideas on the table. We feel like there are 4 things that could happen right away that would have a meaningful impact as we think about other ways to envision our system, and many of them you've heard already. Punitive damages reform. Increase the burden of proof. Right now, it's the lowest standard as a preponderance of evidence, which means just if it was more likely than not that you think something bad happened, you can have my home. We feel like if we're going to have punitive damages, you need to be able to prove that a physician or another clinician willfully hurt you. And that burden of proof needs to be much higher. We also should say that there could be a cap on punitive damages to provide stability and predictability where physicians at least know what their risk really is in a world in which insurance companies are not going to cover them for that additional risk of punitive damages. I'd also just like to remind the legislators here that when you all, not necessarily you all with your votes, but the legislature as a body, when you pass the Tort Claims Act, under the Tort Claims Act, punitive damages are specifically prohibited. You cannot go after punitive damages in the Tort Claims Act. And under the Civil Rights Act, the $2 million cap is an all-inclusive cap, including punitive damages. You cannot get punitive damages outside of that cap. So the state itself said, we are not going to expose ourselves to the risk of punitive damages. Why then are we exposing our physicians to that risk? The definition of occurrence is something we think is very important. This is the stacking of claims. It's intended that one surgery is one injury, regardless of how many clinicians are in the room. But under the definition of occurrence right now, it's very loose. And that one surgery, if there's 5 clinicians in the room, could be 5 occurrences. So when we talk about predictability in the insurance market, imagine that I'm an insurer and I'm now writing a policy where I don't know if that surgery is a $6 million risk or a $30 million risk. That is what creates problems we feel in our insurance market and is a disincentive for more individuals to be participating in it. We'd also like to see some changes around the collateral source rule. This means the cost of the actual care and the value of a judgment. I'm sure that you've all seen a statement of benefits. When you go to the doctor, you get a statement of benefits from your insurer afterward, and it says, the doctor billed us $100 for your visit, but we negotiated with them a discount and we actually paid them $80 for the visit, not $100. Right now, our judgments are being based off the value of what was billed, not what was actually paid. And in a world in which we are trying to make sure there's solvency in the PCF, judgments are kept in a way where the insurers are able to have predictability for underwriting and the cost of premiums can be affordable for physicians, why would we be paying more than the care actually costs to take care of our patients if they are injured? We also think hospitals remaining in the PCF is incredibly important. We are concerned about the solvency of the fund if the hospitals leave at the end of 2026. And we think that there have been appropriate changes made to the amount of money the hospitals are paying into the PCF after the last 4 years. And with that work, they're on a very good footing. Remember, all of the physicians that work in our hospitals right now have access to PCF coverage. And as soon as the hospitals are forced to leave, those hospitals take their physicians with them. So it's not just a hospital administrator question, it's also the people who are working in the hospitals. There are a lot of ideas on the table. Like I said, the governor has stepped up and is showing leadership on wanting to fix these problems. You all as a caucus have been with us from the start. You fought for changes in 2023 to independent outpatient facilities, and you have introduced countless bills to solve this problem over the last 4 years. We have the data and the experts to create real solutions. There's no question there. The question is, do we have the political will to implement the solution? When all is said and done, we believe we have a moral obligation to act. We passed a bill in 2021. That bill was bad. It doesn't work. It set up an unbalanced system that has proven to have horrific consequences for the well-being of the vast majority of our neighbors. But the beauty of our government is we don't have to live with our mistakes. We can fix them. There's no doubt in my mind that we can solve this crisis if the majority of your colleagues in the legislature want to. And we look forward to working with you all as we embark on the challenge.
Thank you. I really appreciate both of you and kind of giving us some of the solutions. I've heard a few of these before, all of them, but I just really appreciate it. My issue is, and I'm going to say this is not a question, so don't try to answer it because I don't want to put you in hot water. But I don't know how you get past the trial attorneys that run the Judiciary Committee and run the Senate floor. So I will say it so I can get in hot water, but I'm not asking you guys to put into it. But we need to understand that you got a trial attorney who's the chair of the Senate Judiciary Committee, and you've got a trial attorney that's the majority floor leader. How's that for a spade is a spade? Let's just call it out. They're not going to let that bill get heard. So we could have 110 people co-sponsor the bill. It ain't going nowhere in those two committees. It's not going to happen because they're going to block it every single time. So until their constituents get mad enough about having to go out of state to get medical care or wait for 18 months to get seen for an appointment, if they get mad enough to vote them out of office, it's not going to change. That's just, I'm sorry, that's just facts. Facts are facts. Truth is truth. And the fact right now is that you've got 2 to 3 senators, the third one being Katie Duhigg, who is blocking these bills from being able to go anywhere. And so until their constituents start calling them and saying either support changing this or I'm going to support removing you from office, it's not going to change. Again, I don't need your comments on that. Now, I'll open it up if anyone has questions, but we just have a few minutes left. I do want to make a couple of thank yous. Dave, thank you for being here. I know you're the past chairman of the commission. I want to thank Catherine Cullen for coming. Representative Cullen partly represents some of this area, and of course, Mayor Hall. I also want to give a shout out and thank our sheriff's department for providing security with all the craziness that's been going on in our country the last couple of months with political violence. I just want to thank the sheriff's department for being here to protect us. Thank you very much, gentlemen. Anyone have any questions quickly? Or should we leave on that note? Thank you.
I think you summarized it well.